Another pose. 1, 2, 3. Once again, thank you for the KKM traditional dance from Nursing Department, Poltekkes Kemenkes Semarang. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Best wishes for all of us. The Honorable Dr. Sugianto, Sarjana Pendidikan Master of Applied Science, the Director of Poltekkes Kemenkes Semarang. Dr. Bejo Santoso, Sarjana Sains Magister Kesehatan, the Vice Director 1 of Poltekkes Kemenkes Semarang. Dr. Supriyadi, Master of Nursing, the Vice Director 2 of Poltekkes Kemenkes Semarang. Mrs. Esti Handayani, Master of Midwifery, the Vice Director 3 of Poltekkes Kemenkes Semarang. Mr. Sudiarto, Master of Nursing, the Head of Academic Administration and General Affairs of Poltekkes Kemenkes Semarang. Mr. Sumarto, Sarjana Pendidikan Master of Nursing, the Head of Semarang Nursing Department. Mrs. Elisa, Sarjana Keperawatan, Nurse Magister Kesehatan, the Secretary of Semarang Nursing Department. Nurse Iis Riningsi, Sarjana Sains Terapan, Magister Kesehatan, the Head of Nurse Profession Program. Mrs. Kurniati Puji Lestari, Sarjana Keperawatan, Magister Kesehatan, the Head of Bachelor of Applied Nursing Study Program. Dr. Dr. Nina Indriawati, Master of Nursing, the Head of Diplomatry of Nursing. Dr. Budi Widianto, Master of Nursing, the Chief of Student Administration, Alumni and Cooperation. All Head of Department in Poltekkes Kemenkes Semarang. Thank you to our media partners at Info Poltekkes and at Info Lomba Nasional for contributing to the success of this event. The honorable, respected speakers of today's event, Dr. Sugianto, Sarjana Pendidikan Master of Applied Science, the Director of Poltekkes Kemenkes Semarang as the keynote speaker. Mr. Mardiono, Master of Nursing Science, Doctor of Philosophy from Indonesia as the first speaker. Mrs. Femke van der Heijden, Master of Science from Netherlands as the second speakers. And all lecturers and invited guests who are attending this international conference. Chairman of the Student Consultative Council, President of the Student Executive Board, Chairman of the Student Council, Governor of the Student Association, distinguished participants, ladies and gentlemen, both present here in person and online. We are delighted to welcome at Poltekkes Kemenkes Semarang in the event of 3rd International Conference on Nursing Education, Research and Clinical Practice 2025. First of all, we would like to thank God. Because of His grace, we can gather here in the event of 3rd International Conference on Nursing Education, Research and Clinical Practice 2025 by team Caring Beyond Borders, a comprehensive nursing approach to health, culture, and chronic conditions. I am Dava Ulul Azmi as the Master of Ceremony in this event. On behalf of the committee, we greatly appreciate every one of you for being able to be here to attend the 3rd International Conference on Nursing 2025. Before we proceed, please allow me to read the agenda as follows. First, opening. Second agenda, singing National Anthem Indonesia Raya, Mars and Hymne Poltekkes Kemenkes Indonesia. Third, praying. Fourth agenda, reported by committee chairperson. Fifth agenda, welcome speech by Head of Nursing Department Poltekkes Kemenkes Semarang. Sixth, speech by the keynote speakers. Seventh, poster display. Eighth is the main agenda of 3rd International Conference on Nursing. And the last agenda is closing. Distinguished guests, participants, ladies and gentlemen, for a brief moment, we would like to invite you to stand up and singing National Anthem Indonesia Raya, Mars and Hymne Poltekkes Kemenkes Indonesia. Ladies and gentlemen, please stand up.
Dharma sebagai pedoman kami, membangun hidup berdiri tak pernah henti untuk Indonesia tercinta. Poltekkes Kemenkes di Indonesia siap mengabdi nusa dan bangsa, berbudi luhur, berakhlak, berbudaya, berbakti demi tugas mulia. Poltekkes Kemenkes di Indonesia bekerja profesional mendunia, semangat juang tak pernah padam untuk kesehatan bangsa. Siap melangkah untuk berbakti, di Dharma sebagai pedoman kami, membangun hidup berdiri tak pernah henti untuk Indonesia tercinta. Poltekkes Kemenkes hebat, Indonesia sehat. Kami insan negeri tercinta, penjaga kesehatan bangsa, menjunjung nilai-nilai kemanusiaan, berbudi luhur, berakhlak dan berbudaya. Kami Poltekkes Kemenkes Indonesia berjanji pada bangsa dan negara, bekerja profesional, berprestasi, melangkah bersama mandiri mendunia. Kami Poltekkes Kemenkes Indonesia berjanji pada bangsa dan negara, penuhi panggilan untuk mengabdi, berjuang dengan segenap jiwa raga, berjuang dengan segenap jiwa raga.
And for those who are non-Muslim, you may adjust accordingly. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillah. Wassalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajmain. Amma ba'du. Ya Allah, our Lord, thank you for your blessings, mercy, and guidance which enable us to gather here today at the third International Conference on NERCI 2025. Ya Allah, the most merciful, the most gracious, by your grace and mercy, we pray that all the activities in this event can run smoothly as they should, to bring us new knowledge, to be useful and a blessing for all of us. Ya Allah, guide us with your guidance, bless us with your blessings, and make our heart always pleased with your gift. Ya Allah, make our life easy, because nothing is easy unless you make it easy. Ya Allah, grant us patience and strengthen our heart in facing both success and failure. Ya Allah, may this event increase our knowledge, skills, and ability to face future challenges. Ya Allah, grant our prayers. Rabbana atina fid dunya hasanah, akhirati hasanah, wa qina azaban. Subhana rabbika rabbil izzati amma yasifun, wa salamun alal mursalin, walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Muhammad Raka Prabu Pratama for leading the prayer. Ladies and gentlemen, the next agenda is reported by Committee Chairperson Tabit Rafiano Abul Kasis. We invite Tabit to deliver his reported.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Best wishes for all of us. The Honorable Dr. Sugianto, Sarjana Pendidikan Master of Science, the Directors of Poltekkes Kemenkes Semarang, Dr. Bejo Santoso, Sarjana Sains Terapan, Magister Kesehatan, the Vice Director 1 of Poltekkes Kemenkes Semarang, Dr. Supriyadi, Master of Nursing, the Vice Director 2 of the Poltekkes Kemenkes Semarang, Mrs. Esti Handayani, Master of Midwifery, the Vice Director 3 of Poltekkes Kemenkes Semarang, Mr. Sudiarto, Master of Nursing, the Head of Academic Administrations and General Affairs of Poltekkes Kemenkes Semarang, Mr. Suharto, Sarjana Pendidikan, Master of Nursing, the Head of Semarang Nursing Department, and all the Head of Department in the Poltekkes Kemenkes Semarang. To Honorable, respected speakers of today's events. The first one is Dr. Sugianto, Sarjana Pendidikan, Master of Applied Science, the Director of Poltekkes Kemenkes Semarang, as the keynote speaker. The second is Mr. Mariono, Master of Nursing in Science, Philosophy Doctor from Indonesia as the first speaker. And the last one is Mrs. Femke van der Heijden, Master of Science from Netherlands as the second speaker. All lecturers invite guests who are attending in this international conference, presidents of the Student Executive Board, the chairmen of the Student Consultative Council, chairmen of the Student Council, governor of the student associations, and then that I love and am proud of my fellow committee members who have contributed greatly to the success of this event. Distinguished participants, ladies and gentlemen, both present here in person and online. On these occasions, let us give thanks to God Almighty. By His grace and blessings, we are able to gather here together the third International Conference on Nursing Education, Research, and Clinical Practice 2025, organized by the Research and Development Divisions of the Semarang Nursing Student Associations. The theme we raised in this activity was Caring Beyond Borders, a comprehensive nursing approach to health, culture, and chronic disease conditions. The background for choosing this theme was related to the condition and chronic disease that continue to increase every year throughout the world. As aspiring professional nurses, we must improve our understanding and skill as medical practitioners in dealing with complex and rapidly developing chronic conditions. With the latest technological development and research, this event provides an opportunity for participants to update their knowledge on the latest diagnosis, leading treatment methods, and effective management strategies for dealing with chronic conditions. Please allow me to report that the third International on NERCI was held on September 23 until 24, 2025, both online and offline, or using a hybrid method at the theater room of postgraduate building of the Poltekkes Kemenkes Semarang. This event was attended by 926 participants who took part in the conference seminar and abstract part presentations. This event was fully supported by the nursing departments of Semarang, as well as media partners who contribute to the events, namely at Info Poltekkes and at Info Lomba Nasional. It was also fully supported by the nursing students of Poltekkes Kemenkes Semarang. I would like to express my sincere gratitude to all parties involved for the assistance and support, which contribute to the smooth running and success of this event. May this event run smoothly from start to finish, and may it provide tangible results for all of us, both now and in the future. I am Tabitra Viunablukasis, as the organizing committee, representing all of my fellow committee members, would like to express our gratitude to all parties who contribute to the success of the third International of NERCI 2025. We, the entire organizing committee, also apologize if there are still many shortcomings and mistakes in these events. That is all from me. Please excuse me if there are any words that may be offensive. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Tabitra Viunablukasis, for the reportage. Distinguished guests, participants, ladies and gentlemen. Next agenda is welcome speech by Head of Nursing Department, Poltekkes Kemenkes Semarang, Mr. Suharto, Sarjana Pendidikan Master of Nursing. We invite Mr. Suharto to deliver his speech.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Best wishes for all of us. Excellency, our keynote speaker, Director of Poltekkes Kemenkes Semarang, Dr. Sugianto, SPD MFPSC. First speaker, Pak Mardiono, MNS PhD. Second speaker, Femke van der Heijden, MSc from Netherlands. Maybe not yet in the show. Third speaker, Joylin L. Medjila, MBA, Man RN from Philippines. And the fourth speaker, Ibu Titin Sueri, tersebut. And fifth speaker, Ms. Hira Kumari Niraula from Nepal. And the Honorable all the Vice President Director of Poltekkes Semarang, Head of Academic and General Administration, and Your Honorable Head of Radiology Department, Bu Fat. Thank you. And Bu Simas, Ibu Dr. Simas, Ibu Dr. Fat, and all department. The Honorable Secretary of Nursing Department, Hub of Study Program from Semarang, Blora, Pekalongan, Tegal, Purwokerto, Magelang, and KUPP Kendal, and also which we respect and applaud all of lectures and invited guests who have attended in this seminar. Dear HIMA, DEMA, and committees that work hard to prepare and organize this event, so the seminar will goes well. And also, the dearest all participants in the International Nursing Seminar. First of all, peace be upon of you and Allah mercy and blessings. Welcome to Nursing Department. Poltekkes Kemenkes Semarang in the event of Seminar International of Nursing 2025. We thank God for the presence of Allah Subhanahu wa Ta'ala because we are still given the opportunity to gather in this seminar in good health without any shortcomings. We also thank God because of His graces we can gather in this occasion. Secondly, on behalf of Nursing Department, we greatly appreciate every one of you for being able to be here in the middle of your busy time and also give support to us in this great event. Ladies and gentlemen, this activity will last for 2 days and the activities will be carried out seminar, poster, and also abstract. I apologize for any mistake that we have made while conducting this event. Have a nice day and enjoy this seminar and see you in the next Nursing International agendas. Finally, before I end of my speech, I hope Bapak Direktur, can you officially open this event and give speech? Thank you very much. Thank you for your kind attention. Wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Suharto for the welcome speech. We would like to hand over the e-certificate to Mr. Suharto. Please stay and take position. We invite the committee to hand over it. We invite the committee to hand over it.
Gak kuat anjing kayak pipis kak. Oh kali ini baru semuanya. Gak kuat kali ini baru semuanya.
Once again, thank you to Mr. Suharto. Please be seated. Ladies and gentlemen, during the seminar, we kindly ask you to keep your microphones muted. Please unmute only when you are given permission by the moderator. For all participants attending in person, we request that you remain quiet during this session. All materials presented in this seminar will be shared through the Telegram group. The speech of the keynote speaker. Dr. Sugianto, Sarjana Pendidikan Master, the Core of Global Health Transformation and Chronic Disease Preparedness. For Dr. Sugianto, the time is yours.
Gentlemen, distinguished guests, the Vice Director of Finance and Human Resources, Dr. Supriyadi MN, Head of Nursing Department, Pak Soeharto, SPD MN, Head of Department in Poltekkes Kemenkes Semarang, invited speakers, Bapak Mardiono, MNS PhD, Plum Femke van der Heyden, is this correct? Yeah. MSc, Joylin L. Mejilia, MBA, MAN, and RN. Ibu Titin Suheri,
Nggak bisa
SKP
anjing, pengen
MSc,
pipis banget.
Ira
Fuck,
Kumari
nggak bisa,
Niraulan,
Pak.
and also moderator, Bapak Dr. Budi Widianto, MN, all head study program and lecturer of nursing department,
Pipis anjir nih. Ya,
all
headphone.
of the
Nggak bisa
nursing
anjing.
students and all participants. It is truly an honor for me to be here today at the third International Conference of Nursing, Education, Research, and Clinical Practice in NERCI 2025, hosted by Poltekkes Kemenkes Semarang. I would like to express my deepest appreciation to the organizing committee for bringing us together in this event under the theme Caring Beyond Borders, a comprehensive nursing approach to health, culture, and chronic conditions. In this rapidly changing world, health systems are constantly challenged by globalization, cultural diversity, and the rising burden of chronic diseases. Nurses, as the backbone of healthcare, play a pivotal role not only in providing direct care, but also in shaping adaptive, resilient, and transformative health system. Today, I'm privileged to share with you my keynote presentation under the topic Adaptive Health Systems, the core of global health transformation and chronic disease preparedness. This topic is fascinating because it highlights the urgent need for innovation, collaboration, and cultural sensitivity in developing health systems that are both resilient and responsive to global health challenge. Demographic changes, urbanization, modern lifestyle, and longer life expectancy have driven a rise in chronic diseases like diabetes, hypertension, cancer, and cardiovascular disease. Traditional reactive healthcare systems are no longer sufficient, as seen during COVID-19, when routine care was disrupted. adaptive healthcare system, flexible, resilient, and able to anticipate, respond, learn, and adjust to social, environmental, and epidemiological changes are needed to maintain essential services. These trends underline why strengthening health system is essential in protecting communities and ensuring continuity of care. One, increase in chronic diseases. Two, the COVID-19 pandemic has exposed the weaknesses of inflexible systems. And three, new threats, climate change, urban growth, aging population, and international mobility. And four, a system that is not only responsive, but also proactive is needed. Adaptive systems are built on several core components that enable flexibility and long-term resilience. First, governance, transparent, flexible, and accountable. Funding, sustainable and adaptive. Health workers, skilled, responsive, and protected. And primary care, robust, with a focus on chronic diseases. And about data and information, need real-time digitization and is necessary. We'll look at the case study countries with the strong primary care services and real-time data proof to be more effective in maintaining services for chronic diseases during the COVID-19 pandemic. For example, the UK's NHS used remote consultation to maintain follow-up for people with diabetes, while Rwanda strengthened community health workers program to integrate care for infectious and chronic diseases. Research shows that the system needs to not only be resilient, but also transformative. The challenge, once unequal access to services between regions, limited resources about labor, funds, and infrastructure, and inflexible rules and bureaucracy, and for lack of local data and separate data systems. The strategies and the best practices. One is monitoring system for NCDs. Two, integration of chronic diseases services into primary care. Three, utilization of digital technology, such as telehealth and applications. Four, intersectoral cooperation, education, transportation, and nutrition. Five, flexible funding and mechanism for emergencies. Six, training for health workers in adaptations regarding crisis and technology. And seven, incorporating adaptation into long-term plans. Ladies and gentlemen, the role of chronic diseases in preparedness, long-term health is essential, and disruption can have a significant impact. Risk factors for chronic diseases increase during crisis, such as economic crisis, natural disasters, and pandemic. For example, people with diabetes or hypertension are a greater risk if supply chain for medicines are disrupted after a disaster. Integrating monitoring for NCDs and infectious diseases can strengthen the overall health system. Conclusion, adaptive health systems are an important part of global health transformation. Countries are expected to build proactive, inclusive, and flexible system. It is important to invest in infrastructure, human resources development, information system, and policies that can adapt well. Community involvement and cross-sector collaboration are key factors in improving resilience. A shared commitment from governments, professionals, and communities is essential to turn this vision into reality. With that, let us officially begin the International Conference on Nursing, Education, Research, and Clinical Practice in NERCI 2025 with Bismillah. Bismillahirrahmanirrahim. I hope this discussion will inspire us to strengthen our commitment, to share insight, and contribute towards building a healthier, more prepared, and more compassionate world beyond borders. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you to Dr. Sugianto for the speech. We would like to hand over the e-certificates. To Dr. Sugianto, please stay and take position. We invite the committee to hand over it. Thank you very much to Dr. Sugianto. We sincerely hope you can stay with us until the end. Should you have other engagement, please feel free to continue with your next activities. Ladies and gentlemen, the next agenda is the poster display, showcasing a range of scientific contribution from the participants of the International Conference on NERCI. Before we proceed to poster presentation, allow me to invite the reviewer to come to the stage. For Associate Professor Dr. Arwani, Sarjana Kesehatan Masyarakat, Bachelor of Nursing, Honors Master of Nursing, and Dr. Roro Sri Endang Pujiastuti, Sarjana Kesehatan Masyarakat, Master of Nursing Science. Please come to the stage. Once again, Allow me to invite the reviewer. The reviewer in the first and second poster presentation is Associate Professor Dr. Arwani, Sarjana Kesehatan Masyarakat, Bachelor of Nursing, a nurse, Master of Nursing, and Dr. Roro Sri Endang Puji Astuti, Sarjana Kesehatan Masyarakat, Master of Nursing Science. For Dr. Roro Sri Endang Puji Astuti, please come to the stage. Okay, we now invite the first participant to begin her poster presentation. Please welcome to the screen, Shalsa Mareta Zahara, Sarjana Terapan Keperawatan. You have 5 minutes for your presentation and 2 minutes for the Q&A sessions. For Shalsa Mareta Zahara, Sarjana Terapan Keperawatan, your time begins now. Ladies and gentlemen, we are going to the next agenda. It's the main event of Third International Conference on Nursing 2025, Caring Beyond Borders, a comprehensive nursing approach to health, culture, and chronic conditions. This morning agenda will be guided by Dr. Budi Widianto, Master of Nursing, as the moderator. Please allow me to read the moderator CV. Dr. Budi Widianto, Master of Nursing, is a lecturer and researcher at the Poltekkes Kemenkes Semarang. He holds a doctorate in public health from Diponegoro University and a Master of Nursing degree from the University of Melbourne. His expertise covers community nursing, family nursing, infection control, as well as the use of plasma and ozone in the nursing service. His professional career began as on-site paramedic at SOS International Corporation in 1997, where he was responsible for clinical management, emergency call, and rural area referrals. From 1998 to 2003, he worked as a lecturer at Blora Nursing Academy, contributing to teaching, field practice, and dormitory management. Since 2004, been serving as a lecturer at Poltekkes Kemenkes Semarang, engaging in teaching across different study programs, diploma, professional, and master's program, while also actively involved in research and community service. In addition to his academic career, Dr. Budi has experience as a speaker at various professional forums. He presented on family nursing at Yapindo, UKOM Diploma 3 of Nursing, discussion in February 2025, and on renal health at the international conference organized by Blora Department of Nursing in July 2024. Fluent in English and Kroma Inggil, Dr. Budi continues to dedicate himself to advancing nursing education, professional practice, and research, with strong involvement in community and organizational activities. That was the moderator CV. Now, I will give the time and place to Dr. Budi Widianto, Master of Nursing, as the moderator.
Okay, all right. Thank you, Mr. Master of Ceremony, for the time given. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Praise and gratitude to Allah Subhanahu wa Ta'ala for granting us healthy, safety, and countless blessing, allowing us to gather here today for the NERCI, International Conference on Nursing Education, Research, and Clinical Practice 2025, organized by the School of Nursing, Poltekkes Kemenkes Semarang. The Honorable Dr. Sugianto, Sarjana Pendidikan, Master of Applied Science from Indonesia, as the keynote speaker presentation. Mr. Suharto, Sarjana Pendidikan, Master of Nursing. Mr. Mardiono, Master of Nursing Science, Philosophy Doctor from Indonesia, as the first speaker. Mrs. Femke van der Heyden, Master of Science from Netherlands, as the second speaker. Distinguished participants, allow me to introduce myself. I am Dr. Budi Widianto, Master of Nursing. I will be the moderator for the seminar today. In this session, we have two speakers. They are Mr. Mardiono, Master of Nursing Science Philosophy Doctor from Indonesia is the first speaker, and Mrs. Femke van der Heijden, Master of Science from Netherlands as the second speaker. Previously, I will share the agenda of this seminar. First one, presentation by Mr. Mardiono, PhD from Indonesia is the first speaker. Second, question and answer and handover of e-certificate. Third, break time. Fourth, presentation by Mrs. Femke van der Heijden, Master of Science from Netherlands as the second speaker. And then followed by question and answer and handover of e-certificate. And then finally, we have closing time. Ladies and gentlemen, we would welcome our first speaker, Mr. Mardiono, Master of Nursing Science Philosophy Doctor from Indonesia, who will deliver material on the theme Real-World Nursing Engagement in Chronic Diseases on long-term quality of life. Presentation will last for 30 minutes. Previously, I would read the curriculum vitae from Mr. Mardiono. Mr. Mardiono is an academic researcher and nursing practitioner who has been working for more than 3 decades. Currently, he serves as the Secretary of the Diploma 3 Nursing Program at Purwokerto Polytechnic Semarang and has been entrusted as the Chair of the Indonesian Holistic Nurses Association 2023 up to 2028. His areas of expertise include medical surgical nursing, holistic nursing, and non-communicable disease management. Mr. Mardiono's academic journey began with basic nursing education at the Semarang Nursing Academy, which he completed in 1992. His passion for continuing his education took him to Thailand, where he pursued his bachelor and master degrees in nursing at Prince of Songkla University, earning his Master of Nursing Science degree in 2004. His academic journey reached its peak when he earned his PhD in nursing from the same university in 2012, with a dissertation focusing on spiritually based intervention for patients with acute heart disease. Mr. Mardiono previously served as head of the Master of Nursing program at the Semarang Ministry of Health Polytechnic 2016 up to 2023 and had the Institutional Development Unit 2014 up to 2016. He has also been actively teaching at the Purwokerto Nursing Academy since 2002, with his early experience as a clinical nurse at PKU Surakarta Hospital and a nursing school in Central Java in 1993. His research interests include spiritually, holistic nursing, caring practice, critical nursing, and herbal nanoparticles. His dissertation examined the effectiveness of Islam-based interventions in reducing anxiety in patients with acute myocardial infarct. In addition, he is active as a reviewer for various national and international journals and served as chief editor of the NERCI Nursing Journal. As a research person, Mr. Mardiono is often invited to national and international scientific forums. He has been a visiting professor in Thailand, Japan, Australia, presenting material on holistic nursing, complementary services, and innovation in nursing education. To Mr. Mardiono, the screen is yours. Yeah, all right. Time is yours, Pak Mardiono.
Thank you, Mr. Budi.
Yep, go ahead.
Hello, host. Could you disable to share screen, please?
Yeah, it's clear now.
Assalamualaikum warahmatullahi wabarakatuh. Let me check the voice. Is it clear, Mr. Budi?
Yeah, it's clear now.
Okay. I am glad to be here to join the international conference held by Nursing Department Polytechnic Kemenkes Semarang, and the theme of Caring Beyond Border, a comprehensive nursing approach to health, culture, and chronic conditions. And thank you very much for other speakers. Let me introduce for first topic that the real world nursing engagement and nursing kidney disease that I'm going to explain or share the current knowledge about long-term quality of life and chronic kidney disease, and then factor on long-term quality of life. And the most important and the third part is holistic nursing approach to long-term quality of life in chronic kidney disease. And the last part, I think we need to see in further innovation on long-term quality of life. So we hope we can discuss at that point, especially for the current method, how to care long-term chronic disease, especially in chronic kidney disease. In general, that chronic kidney disease patients mostly face from, we can like follow journey from the first stage, and then or we can say start from early diagnose for kidney disease. Patient facing some like lack of information can cause the psychological and then physical problem that they may not know that how to deal with the disease. And then coming to the more severe, next please. I think you need to follow my, and then from that point, I mean, if the patient already diagnosed and then start from especially in lack of knowledge and then can cause the psychological problems, and then others they have to change their life. So that's why among the core of quality of life, such as physical, especially, and then psychological, and then some cognitive for understanding some uh, treatment or maybe life changes. So that's why they need to adapt and then adjust to, especially to how to looking for treatment, how to deal with the problem, especially the chronic kidney disease. They will go along on their life, and then they may need to have some social adaptation because they may some meet people the same chronic disease, and then some disturbance also from the culture. I think in Indonesia for culture would be positive support to the patients because the chronic kidney disease is kind of the just in general and like we call terminal disease, and then the good side from community, the good support to the people, especially from family, because the people have some problem from chronic kidney disease. They will have to like along the way their life, they have to face the burden, they have to face the psychological distress. So that's why mainly majority of Indonesian or other people they need to like strengthen the spiritual potential or the spiritual coping mechanism, the spiritual support from others to make it build up the resilience, to build up the patience, to build up the life spirit to help deal with the chronic kidney disease. That's why this the theme on the condition of the kidney disease patient is very good to see from patient side that they will have some uh, all of the aspect of quality of lives, physical to spiritual, they have to change and then they have to like a problem. So that's why from healthcare provider, especially for nephrology nurses, we need to understand the phenomena, the problem, and then social problem, and then economic problem, especially for health insurance claim from the main problem. Next, please. The next bit, yeah. So, key factor of the long-term quality of life after the diagnosis, and then I explain if they go to the second stage of the uh, kidney failure, especially they have to deal with the drug, and then if already indicated to be treatment by hemodialysis, so it is quite exhausting because they may go away, I mean, go with the treatment every weeks. So it's very important for physical problem to affect to like decrease the quality of life in terms of the physical healthy and then very modern or maybe very advanced treatment, especially hemodialysis or maybe some treatment peritoneal dialysis also. And others that we can modify it or maybe can afford to maintain their health, especially the anemia. Based on the pathology that patient chronic kidney disease or maybe kidney failure especially, of course they will affect on the majority of the blood cells. So that's why it can cause the anemia. So it's very this is typical of chronic kidney disease or kidney failure. They have some anemia problem. So we need to like consider what kind of the diet, what kind of drugs to increase the hemoglobin level. And other thing, some patient they also have some problem with obesity, and mostly the patient obesity suffer from diabetics and cause the kidney failure. So like complication of the diabetic patient can cause the kidney failure. So this is the main root of the problems before they have kidney failure or kidney disease. And others, the effect of the changes and then the pathology, of course, the patient, especially what I explained before, that people they may not absolutely understand all the information about the disease, and then they may know some how to deal with the disease, and then what kind of treatment, and especially because the patient kidney failure or maybe very uh, treatment by hemodialysis, they have to have the health insurance that some people, some patient, they may not get health insurance, so can cause anxiety and can cause depression, especially depression. Depression is not only from the pathology of the disease, but uh, some of the patient and family is distressed from the health insurance. They don't have like a health insurance cover. Next. And then some factor next from this can cause the long-term quality of life, like related to the obesity, some comorbidities that very common and most happen in Indonesia is diabetes patient and hypertensions. There's, those two diseases can cause the especially chronic kidney disease or kidney failure, and the highest can be the hypertension rather than the diabetic complications. So this is the from nephrology nurses to understand the phenomena, and we have to look for like treatment and then to understand the pathology. It's not only depend on the hemodialysis and the drugs, but we need to looking for some cultural potential or maybe some spiritual approach to help the patient to overcome the pathology, not only the psychological and social and spiritual aspect. And then likely that the patient already get the treatment that hemodialysis is especially the end state of the patient, they may have to main problem, especially from the treatment and the prognosis of the disease. If already go to the end state, means that the patient to be accept that they have to live with the hemodialysis and they have to modify the lifestyle, and they have they have to follow the strict uh, diet and liquid management to maintain the stability of the condition. So this way it can be affect on the psychological aspect, and then from spiritual aspect that can cope and deal with the situation. And other aspect that I already explained related to the psychological, spiritual, mean that we need to like build up the resilience of the patient to grow up the life spirit. This is very important because if the psychological status and then cognitive status is not positive way, mean that patient inside from inside that to make it like prone their own self, not only from the disease but from the psychological and spiritual aspect to like make it worse. So that's why other thing also, especially for case manager, we need to like manage the health insurance, especially for the chronic kidney disease and patient need to have support from to cover the health insurance, because it's just, obviously the budget is very high cost, and then as related to the insurance department also that the proven of the budget come from the not only from cancer but from renal failure. Next, please. So from understanding the phenomena, we try to manage. There are uh, 3 points that we can like follow or develop our approach to the patient based on the previous or maybe can be said like the basis of nursing management for kidney failure disease patients, we normally apply the symptom management because the patient develop some symptoms start from maybe fatigue and then pruritus and then especially for hypervolemia, anxiety, and then very pathologic laboratorium to show the progress of the stage of the kidney failure, hyperuremia, and then hypercreatinine. And then this can be like patient also need to develop the self-care themselves, not only depend on nephrology nurses, but we need to build up from family and then from patient themselves to improve some self-care that to deal with the chronic disease. And then the second, this is like a very current approach how to deal or how to care for the patient. Previously, we not only the symptom management and then we follow the palliative care. Now we have like a new, or we can like appreciate the kidney supportive care. This like combination between palliative care and then holistic care. So integration kidney care and the palliative care can be new approach, especially for nephrology nurses. We need to see the progress on the development and the approach of these two things that like to enhance our quality of care in clinic way. And then as a progress in the Internet of Things need, so it is common also we have nursing informatics and telemedicine that can help the patient, can help the nurses to improve the quality of care, to improve the self-care, to improve the fighting spirit, and then to provide the patient and the family to care for the patient, especially they already stay at home after treatment, especially. Next, I'm going to symptom management from next, please. This approach actually already familiar with us that we can see how to monitor the adherence to medication, especially the patient, because this patient is chronic disease, means that they have to like obedient to help, like uh, to see, I mean, to consume, to take the medicine. So that's why not only the patient themselves, but family also to remain to comply the therapy regimen, either for diuretic drug or diuresis or antihypertension, especially who suffer from hypertension and then had complication the kidney failure. And then uh, from nursing, both nurse nephrology and then patient also to monitor the symptom from himself themselves, like especially we can or we did the level of creatinine, urium, and then to educate what the level, and then we have to like help them calculate the uh, GFR to see the level of uh, kidney failure, because from that point, not only the patient, but especially for nurse and medicine to follow the treatment, to follow like for a self-care intervention from maybe complementary therapy that we can like use to the patient, because Indonesian or maybe in ASEAN countries, uh, not only the medical treatment, especially drug and hemodialysis or peritoneal dialysis, but we need to have some like can be complementary or alternative therapy can be help them to deal with the chronic disease. And then modification, it is compulsory or understand by the patient that based on the progress or severity of chronic disease, they have to manage themselves, especially like the diet and then liquid management. Or some may have to stop smoking if some of them still have smoking behavior. And then uh, next to success the life modification or life changes. So we need to have some problem solving between uh, especially nephrologist and the patient to discuss to solve the problem, especially start from the symptom and then going to another problem, go to treatment, or we can go to the financial, especially for health insurance, how to get the health insurance. This is a common problem that we face in the patient. And then before, I mean, the way how to install, how to improve the resilient skill or the life. So the coping mechanism and adaptation of the patient, it is very important and is useful to them by educating the patient how to like enhance the coping based on the family sport or based on the spiritual sport or maybe some cognitive therapy uh, to achieve the adaptation, to achieve the way of thinking, maybe like to make it strength from psychological or spiritual, but we have to start from the cognitive or understanding something. So it is very good to improve their skill in uh, enhancing the patient facing the chronic disease. And the last one, not only the problem solving, but from the self-management, they have shared decision making. This point can be emphasized for like healthcare. We can start from nurse and then dietitian, maybe nephrologist, and then psycholog also that or those provider can help the patient to to have the best intervention. So the main treatment is really on the hemodialysis, but others we need to have some alternative, and patient have to be taught how to improve the self-care. So from self-management can be continuing to supportive kidney care. Next, please.
Mr. Marjono,
So
you have
next,
5
please.
minutes. Sorry, Mr. Marjono, you have 5 minutes left.
Yeah. Yeah. So, like I explained, the kidney supported care is very like a current method that we need to have some new approach. I already understand the self-management. So the other one, the other approach, we need to like individual conservative treatment, because even though the similar diagnosis, but the new approach that we need to see the typical of the stage of the kidney failure, and then the behavior related to diet and then activity, and then can be spiritual status also. So this point can be cope, I mean, to help the patient to cope the chronic disease by using the palliative care technique, and then we have to combine with other sport, especially the spiritual sport, because the uh, in chronic and end-stage kidney failure can be spiritual support very helpful to make a patient ready to the the next step, either uh, stay along with the kidney disease or maybe they have to facing the end of life. It, it is also the family also to ready to face the end stage patient. And then coordination the same that I already explained in the safe care, I mean safe management coordination, not only the health provider, but also for the patient. Next, please. Yeah. Based on the improving the nursing informatic can be like help the nephrology nurses to sanitation, especially patient who stay at home, and then good coordination because all of the documentation in one one file, and then can be communicate each other not only in the hospital but maybe patient at home. And then case manager, this is a new spot from case manager. Actually, we have like a social worker, but maybe in Indonesia, social worker still covered by case manager. So to support everything, not only the drug treatment, but maybe financial support and then social support to help the patient, or maybe like build up the community in kidney failure patients. And then organizing care by informatic can be consistent, and I think the information also valid to record all the nursing intervention and progress of symptom. Next, please. And then last one, we also use the telemedicine that by using telemedicine, we can continue, we perform the continuing care. Case manager will handle or maybe will lead the continuing care, not only in the hospital but in the at home or home care. And patient and nephrology nurse can have some communication, monitoring, and consultation each other in two-ways communication. So the last function of the telemedicine, we can like have early detection. So they have like emergency call. So we can support from ambulance in the community. We have a like a good support how to transport to the hospital fastly. So it is good for the patient. So both side the nursing informatic and telemedicine, it is can be good to have like next please to have a innovation
Yeah,
in the
Mr.
future.
Mardiono. Mr. Mardiono.
Yep,
Yes,
it is.
I'm so sorry. Time is over.
Okay. Thank you
Okay.
very much.
Yeah, we will come into question and answer. Okay, well, please give applause once again to Mr. Mardiono, who has delivered his extraordinary material. Thank you to Mr. Mardiono for the interesting presentation. I hope it will be useful for all of us. Dear participants, ladies and gentlemen, let's move on to the next session, the question and answer, with a time of 15 minutes. We will have time for 3 questions. Those in the room are welcome to raise their hands, and those on Zoom can use the raise hand feature or the comment section by introducing themselves. Amazing question answer with ever more amazing answer. Okay, we will start from the Zoom room first. Okay, please raise your hand while in the Zoom room. Yeah, Najwa, please, Najwa. Hello, Najwa. Hello, Nashwa. Are you in there? Okay, no response from Najwa. Okay, raise your hand again from Zoom room.
Ini ada anu, Pak, ada Dewi Savitri. Question from chat box from Dewi Savitri.
Yeah. Okay, I think you need to use your mic.
Okay.
Tolong kameranya diarahkan ke yang bertanya, Mas. Biar Pak Mardiono bisa anu.
Okay, thank you so much for the presentation. I want to ask, what is the role of nurses in helping patients with chronic kidney disease in managing their medication and diet in order to maintain optimal life? Thank you.
Okay, Mr. Mardiono.
Yep.
The question is regarding about the role of the nursing in maintaining the quality of life of the person with a chronic condition. Okay, time is yours.
Okay. So addressing the how to deal the patient who have like a long-term quality of life mean that we focus on the physical regarding your question addressing the diet. Yes, from based on the pathology that kidney impairment or kidney disease that can cause the what they call the impair of the nephrotic can we manage from the diet, especially for protein, because protein and glucose is high molecules. So that's why we need to have like first is low low protein, and then we can provide in essential protein. So we have to understand first there is two type. This is a first essential protein and then the second internal protein. So in general, we like I said low level of protein consumption. Why? Because if we have like a high protein intake, so we can found the protein in our urine. I mean the patient urine. This is uh, uh, the impact of a high protein diet. And then other macronutrient we need to manage, especially if the diabetic patient we maybe following from diabetic diet is a balanced carbohydrate, so maybe already lead by diabetic condition. But if the patient have hypertension, we need to like to manage the low salt consumption, because in chronic disease, chronic kidney disease, especially who already go to stage 2, means that we need to have like a balanced salt, because if the balance salt salt level is quite high in the blood, so can cause the retention of liquid in the blood vessel, can develop the hypertension. So this is another consideration. And if patient already maybe end state, we need to like manage the can be diuretic diet. This is anomaly situation. If state 1 to 3 can be we call like pushed by the diuresis to manage the edema, but in the state 4 to 5 can be less diuresis, even drug and or maybe diet, diuretic diet can be in balance, not too much, uh, because of the function of kidney is getting lower, so the diuretic drug can is not effective to wash out the edema. So between diet and drug, especially the diuretic and drug, we need to like in balance. So this way, not only the diet, we need to
Halo, Mr.
manage the liquid,
Mardiono.
yeah, liquid constraint. Yep. Have you get the answer for my explanation? Hello, Pak Putih. Any question, or we can go to another question? Hello? Can you catch my voice? Or maybe we have. Hello, Bu?
The next question
Hello?
from the Zoom room first. Please send. Hello, any student in Zoom room?
Yeah. In the chat box is there is one question, Pak Putih.
Yeah. Raise your hand and then state your name and your class, and then directly you can answer. You can raise your ask question to Mr. Mardiono.
Okay, I read the question from Dewi Safitri. Can you get my voice, Pak Putih? Let me check my voice.
Yes. Hello. Yeah.
Hello.
Go directly.
Okay, this question from Dewi Safitri. If in the setting, I mean in the hospital or the clinic, there is limited resources, what strategies can nurse use to ensure that chronic kidney patient continue to receive quality care and ongoing support? Yeah, if I mean, the limited resources means that maybe only we have like peritoneal dialysis and then hemodialysis, and the rest maybe we can say like limited or maybe like quite old machine. First of all, regarding to the physical problem from chronic kidney disease, especially the kidney failure, because if we have a problem with us stone kidney disease can be maybe we can have like a limited resources. Yes. Um, First of all, we continuing to other aspect that we need to like enhance or maybe improve the quality of care the patient. If we already get the like basic treatment with the operation or with the peritoneal dialysis or hemodialysis, mean we can like improve or optimize the uh, caring for patient, especially from psychological support. Yes, we can do it. And then social support, we need to like because we already have some communities, mean that introduce them to the new communities of kidney patients can be have some same faith and some resources to the community to share the idea how to deal with and what they can share the experience each other, and then um, they have to like teach them using the cognitive therapy also. Okay, maybe from cognitive therapy, if yeah, what you said, this is limited resources mean that resources from the nurses how to improve the cognitive therapy, because if they don't have enough resources, so they can like in the hospital they can like refer to expertise, maybe some psychiatric nurses or other nurses who work in other ward at expert on the cognitive therapy, and then like go to the spiritual care hospital support. Um, in my opinion, based on the experience in the clinic setting, that all of the nurses, especially the same religion, can support based on the spiritual care. Like Muslim nurses can apply from, I mean, to spiritual support to the patients. This is how to optimize to the so they can start from refer to other ward or maybe other nurses who have a specialty in this one. And then if the patient already stay at home or we undergo in home care, yeah, we have to like networking, mean that we need to provide some expertise, not only in the nephrology nurses, but maybe we can like have some uh, maybe a nurse who expert in hypnosis, or maybe we can consult to the herbalist nurses or medicine. Mean that like we already apply the self management approach and supportive kidney care. Mean that we need to have like a uh, consultation or sharing each other, mean to get the like to fulfill that the gap of our limited resources. This is how to manage to optimize I mean the resources not only in the kidney unit, but we still have in other ward or maybe in the community in other we call specialists to have. This is the system of caring patient in the comprehensive way or in the holistic way. So we try to achieve the care and to get the uh, support from other profession or other ward or other nurses. This is how to manage this one. And especially we have also like case manager, and then I said that we have social worker, especially the patient who stay at home or we run the home care. So it's mean that not only the um, managing the liquid and then diet and then to keep patient in stable, but other problem, especially financial problem, can be discussed with the case manager or maybe in other resources that they don't have health insurance, how to advocate to the government to get or they have to go to the patient that we need to have some discussion how to solve the financial problem or to get the health insurance. This is how to manage the limitation. Thank you.
Okay, thank you, Mr. Mardiono. Please let us hand over e-certificate to Mr. Mardiono to the committee time issues. And to Mr. Mardiono, give us all a round of applause.
Thank you very much, Pak Budi, and all participants from your attention.
For any
We can-
student who raise question on chat room, we are so sorry because time is limited. We can deliver your question to Mr. Mardiono, but you can still contact Mr. Mardiono via chat in WhatsApp or in Telegram or come into Purwokerto. Okay, a certificate. Yeah, this is your certificate, Mr. Mardiono. Thank you very much for your kind participation in this session in NERCI 2025. Okay, give applause again to Mr. Mardiono.
Thank you very much, Pak Budi, for facilitating this session.
Okay, ladies and gentlemen, that was the end of the presentation from the first speaker. We are going to continue with the next event, which is the poster display. I will now hand over the event to the Master of Ceremony. Thank you very much.
Thank you very much to Dr. Budi Widianto, Master of Nursing. Now, ladies and gentlemen, we will move on to the next agenda, the poster presentation session. To lead the next session, we are pleased to welcome our moderator, Retika Flora Dwi Afifa. But before that, to Dr. Budi Widianto, Master of Nursing, please return to your seat. Once again, to lead the next session, which is the poster presentation, we are pleased to welcome to our moderator, Retika Flora Dwi Afifa.
Assalamualaikum warahmatullahi wabarakatuh. Salam Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good afternoon, ladies and gentlemen, honorable reviewers, distinguished guests, and all participants joining us in the Zoom room this afternoon. It is a great pleasure to welcome you to the Third International Conference on NERCI, Nursing Education, Research, and Clinical Practice, which is being held online. May we all be blessed with good health and take part in today's activities without any obstacle. Allow me to introduce myself. My name is Retika Flora Afifa, and I have the honor as the moderator in today's event, focused and timely manner. Before we begin, let me briefly explain the rules and procedure for the scientific paper presentation. First, each participant will have 5 minutes to deliver their presentation. Second, after the presentation, there will be a 2 minutes question and answer session, during which the panel of reviewers may also provide feedback. Third, the next participant will be called once the previous session has finished. We kindly remind all participants to use their time as effectively as possible. Ladies and gentlemen, we have now arrived at the main agenda, which is the poster presentation session. Before we proceed the oral presentation, allow me to invite the reviewers to come to the stage. For Dr. Roro Sri Endang Puji Astuti, Sarjana Kesehatan Masyarakat, Master of Nursing Science. Please welcome. Once again, we invite the reviewers to come to the stage. For Dr. Rosli Endang Puji Astuti, Kajana Kesehatan Masyarakat, Master of Nursing Science. Please welcome. To begin the session, I would like to invite our participant, Chelsea Mareta Zahara, Sarjana Terapan Keperawatan. Our sincere apologies. It appears that the participant is expressing some technical difficulties. With your kind permission, we will now continue by playing the video presentation that has been prepared in advance.
Productive and innovation to improve proper stimulation and monitoring. Unfortunately, many mothers experience difficulties when using the development pre-screening questionnaire in the KIA. Therefore, an innovation was needed, namely the development monitoring disc. The purpose of this study were to analyze the difference in mother knowledge before and after using the disc and to compare its effectiveness with the KIA. We used a quasi-experimental design with two group pre-post tests involving 53 mothers of toddlers. The control group used the KIA book, while the experimental group used the development monitoring disc. The disc was developed using the research and development method and validated by several experts. Pediatrics Dr. Wistiani from Karyadi Hospital, Pediatric Nursing Lecturer Miss Titin and Miss Luci from Poltekkes Semarang, Community Nursing Lecturer Mr. Arwani from Poltekkes Semarang, and midwife Miss Wahyu from Purjatu Public Health Center. The result that the experimental group using the development monitoring disc had a significant increase in knowledge score. The average score increased from 6.5 to 8.34. In contrast, the control group using the KIA book saw only a modest increase for this line. Why was the disc more effective? Because it was visual and interactive, making it easier for mothers to understand, remember, and apply stimulation for their children. The findings are consistent with previous studies, showing that innovative media can significantly improve health, knowledge, and behavior. In conclusion, the development monitoring disc effective improved mother knowledge regarding self-development simulation with a highly significant result p-value 0.00. The innovation not only increases knowledge but also has the potential to enhance modern actual monitoring practice at home. We recommended that future studies explore its effectiveness in improving real practice of development stimulation. Thank you for your keen attention. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you for the participant video appreciation they have. We will now proceed with a question and answer session and feedback from the reviewers.
Okay, thank you. For Salisa, okay, Mbak Salisa, I would like to ask you for this paper, the poster is really great for the figure or informative. You have compared, but I would like to know what is the questionnaire that you already developed for this child development? Can you answer my question first for the reference? And the second question, I would like, what do you have learned from this research? Thank you. Okay, you can answer, or you have difficulties for
Sorry, Ms.
signal?
Rosri Endang. Mr. Salsa was not present on Zoom, so we show a video instead.
Okay. Berarti next presentation ya.
Yes. Next, I would like to invite Abita Lutfiah Pratiwi, Sarjana Terapan Keperawatan, as our next presenter. So that's Tabitha poster for a letter. We will now proceed with a feedback from the reviewers. To the reviewers panel, please proceed.
Mana paper? Udah. Katanya itu. Dan mana? Oke. Belum kan? Moderator, I cannot see the screen share. You can share a full poster, Mas. Just a title. Maybe you can minimize. Nah, okay. Not okay again. Full poster, so everyone also can read it. I don't see it. You can see it. Okay. This paper, you can show all. This is only okay. Nah. Okay, so I can read it, and everyone also can read it. We can read this research poster, the effect of black passage therapy and warm food shock on sleep quality disorder, and Tabitha Titinsueri and is shooting safe. Okay, we can see all together, and it is the good learning for we are in this Zoom or in the NERCI meeting. They already mentioned about the background, objective, yeah, analysis, affiliation, and methodology, result finding, discussion, and conclusion. As reviewer, I would like to share together to make a poster should be on the result and finding. It should more clear from what you learn. Because if I see for the title, it's really complete for the variable. But for finding and discussion, so still limited. Okay. Thank you. I think enough, Mbak. Any add something comment from Bu Endang, Bu Dr. Endang? Not yet. Okay. And then the important thing also about the reference. It's better if we can show from the poster is what is the main reference. However, only 5 or some or yeah barcode. This is the good thing. Okay, I think enough from me. Or still have another can asking. Okay. Oke, Mbak Moderator. Mbak Moderator.
Thank you
I think
to
enough
the
from
reviewers.
me.
And for
Or
reviewers,
I still have time. If still have time, I think.
thank
Okay,
you.
we can.
Thank you to the reviewers. And for the reviewers, please return to your seat. Once again, Thank you to the reviewers, and for the reviewers, please return to your seat. Ladies and gentlemen, before we move on to next participant, we would like to invite the next reviewers. Please welcome Dr. Sri Endang Windy Arti, Sarjana Keperawatan, Nurse Magister Kesehatan. Please welcome.
We can see in meeting room. So Bu Dr. Endang and I, we can review together. So can continue the another poster, please.
Next, we invite Alma, Alma Karisa Kartika Guranto as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Okay, thank you for moderator for giving me time for make a presentation. Okay, in here I want to make a presentation of my case study, and the title of my case study is nursing care for Mrs. W with a diagnosis of congestive heart failure in the ruang mawar of RSUD Dr. Gondoswarna Ungaran. Okay, for the first is a background. The background of this case study is about congestive heart failure. Congestive heart failure is a pathological condition in which the heart is unable to pump blood adequately to meet the body metabolic needs. And what the main cause of CHF or congestive heart failure? The main causes of CHF include coronary heart disease, hypertension, cardiomyopathy, arrhythmia, and other risk factors such as age, family history, or smoking habits. And in the worldwide, prevalence of CHF continues increase significantly, including in Indonesia. So, for understanding about the main cause and the risk factor of CHF or congestive heart failure is very important for effective prevention and treatment of this disease. And the next is about objective to find out nursing care for Mrs. W with a diagnosis congestive heart failure in the ruang mawar of RSUD Dr. Gondoswarna Ungaran. And the method I use is descriptive with one patient who cared for by nurses by 3 days. For 3 days, I'm sorry. And the result of this case study is after nursing care for 3 days, Mrs. W said that her breathless had decreased. She was able to move her legs, although slowly, and the edema in her legs became grade 1 from grade 2. And in here, we can see the table about the first is fluid balance monitoring results. In the first day, fluid balance of Mrs. W is plus 230 milliliters, and the last day is minus 170 milliliters. And because of the result of fluid balance are already minus in the last day, it means that edema in Mrs. W legs must have started to decrease. And yes, we can see in the result about the edema in her legs become grade 1 from grade 2. And the second table is about vital sign. In here, there are blood pressure, blood pressure, pulse rate, and the respiration rate, temperature, and oxygen saturation. In here, we can see about the respiration rate. The first day is 27 and the last day is 25.
Mm-mm.
To reduce
Okay.
Mrs. W shortness of breath and stabilize oxygen saturation, Mrs. W used nasal cannula at 3 liters per minute for 3 days. And the conclusion is providing nursing care to CHF patient is expected to reduce complaints felt by patients, and regular consumption of medication also support recovery for CHF patient. Okay, that's all of my case study presentation. I would apologize if there are any mistakes. Thank you.
Hello. Time is finished or directly I can reviewer, Mbak Moderator? Okay, directly ya. So make efficient the time.
Thank you to Alma Karisa Kartika Guranto for your presentation. We now proceed with the Q&A session.
Okay. So firstly, the report on the poster is really great, yeah. Related with how nurse report related with one patient. And actually is my suggestion. It's a good if you make a poster related one patient, but hopefully the paper is will clearly if you also report about the what is biology, psychology, and spiritual need or other related with other need for the from the patient. So what actually not only with balance, yeah. In your poster still still write about the balance cairan. Jadi masih ada tulisan bahasa Indonesia. Balance cairan. Tipu-tipu ya, kurang check and recheck. And then the another thing, my suggestion, please you report one patient, but with all what is actually nursing role from the nursing care. It is the first. And the second point, from this poster, the student, Mbak Alma, forget to write about discussion and reference. What actually the problem about the patient with the balance fluid? Why nurse really important to monitor balance fluid? It's maybe we can learn together. Yeah. And then another things, what the intervention already give to the patient, which one the have result a good, and then how the response of the patient. It is the important thing for when we show about report paper for the report. Okay. Maybe Bu Endang can add more about this case.
Alma, oke. Saya akan menjelaskan dengan bahasa, mengklarifikasi dengan bahasa Indonesia ya. Untuk presentasinya yang mengenai kasus CHF ya, CHF adalah kelemahan jantung ya. Sehingga kalau menurut saya di sana adalah suatu permasalahan yang sangat kompleks yang terjadi. Akan tetapi di sini memang saya hanya lihat tadi hasilnya adalah balance cairan ya. Memang mungkin harus diperjelas tadi yang dijelaskan oleh Bu Dr. Roro ya, mungkin diperjelas. Kemudian untuk penulisan posternya saya rasa masih terlalu sempit ya, artinya bahwa begini, dalam penulisan poster itu memberikan informasi poin-poinnya saja, tetapi mengena tentang CHF itu sendiri ya. Jadi tidak bermasalah ya, nanti kita perbaiki dalam cara pembuatan poster yang baik ya. Saya rasa itu, terima kasih Bu Dr. Roro.
Okay, thank you. So make a complete, we can learn together. It is not actually in this international conference for nursing, the most important we are here is to learn from the experience, and then actually your friend already present is really great, yeah, really great experience, and another future you can make a report also more and more. Thank you. Please, Mbak Moderator.
Thank you to the reviewers and to the Alma Karisa Guranto. And we now move on to the next participant. I would like to invite Iqbal Didit Aldova as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Okay, thank you for the opportunity. Let me introduce myself. My name is Iqbal Didit Aldova. In this session, I will be presented about my poster with the effect of dietary approach to stop hypertension on blood pressure control in chronic kidney disease patient. Okay, the chronic kidney disease is often occupied by hypertension on uncontrolled blood pressure, increasing cardiovascular risk. The dietary approach to stop hypertension, raise the nutrition and low sodium, has shown benefit to lowering blood pressure, but its effect of chronic kidney disease patient is less explored. In this purpose, I will to how the dietary approach to stop hypertension can be effect on the blood pressure control in patient with chronic kidney disease at RSUD Dr. Gondoswarno with the use method is quasi-experimental study involved to 68 chronic disease patient at RSUD Dr. Gondoswarno. Decide the intervention group use the intervention of dietary approach hypertension, and the control group just only in the education of dietary approach to stop hypertension. So the blood pressure was measured before and after a 2-week intervention. So can be result showing the significant reduction in the intervention group with the systolic pressure is 158.29 mmHg to decrease 149.76 mmHg, and the diastolic pressure 99.12 mmHg decreased to the 94.74 mmHg. Well, the control group is experienced slightly increase, and the next to the program data, I use ANCOVA confirm the significant difference between group intervention and group control with P kurang dari 0,001. Okay, in the conclusion of dietary approach hypertension be effective reduce blood pressure in chronic kidney disease patient and can serve as a non-pharmacological approach to hypertension management. Such study are needs assess a long-term effect the adherence. This QR code about the media can be used the Google Lens, and the iPhone can be use the camera. Thank you for the opportunity. I will bring break to the moderator. Thank you.
Thank you to Iqbal Didit Aldova for your presentation. We now proceed with the Q&A session.
Okay. Bu Dr. Edang, please you make a review for Mas Iqbal.
Oke, saya review. Mohon maaf sekali, tetapi ya, ini karena saya baru mengikuti juga, baru membaca, jadi masih kurang memperdalam apa yang ditulis sama Mas Iqbal dengan judul di sini The Effect of Dietary Approaches to Stop Hypertension on Blood Pressure Control in Chronic Kidney Disease Patient. Ya. Banyak pertanyaan sebenarnya, tetapi dari hasil memang sudah menjelaskan di sana ada signifikansi 0,001 ya, bahwa artinya diet yang diterapkan oleh Mas Iqbal untuk pasien menurunkan hipertensi pada pasien gagal ginjal ya. Ya, menurut saya sini sudah bagus, akan tetapi mungkin penjelasan untuk pemberian nutrisinya itu berapa hari itu ya, karena ini ada treatment dan ada kontrol kalau nggak salah di sana. Kemudian untuk pemberian dietnya seperti apa, kemudian berapa hari, mungkin lebih dijelaskan lagi supaya hanya poin-poinnya saja karena ini bentuknya poster ya. Mungkin supaya kita jelas intervensi yang diberikan. Kemudian untuk hasil tadi sudah jelas signifikan 0,001. Terima kasih.
Okay. Add a little bit, yeah. Mas Iqbal, appreciate for you because you directly present for this poster. So applause for Mas Iqbal. Okay. Yeah. To make you more clear for your contents. And then for the topic is interesting topic. If I would like to suggest and remind us together, for nursing, we can show also so many things about the response patient or what is the nursing intervention. Because now in current day situation, for dietary for patient is under the dietitian role. So if you make a report or you make a content for nursing, you can show about the, for example, how to decrease pain for the patient, how to educate people with the hypertension, how to prevent patient to be stable for the tension, and then prevent patient to be stroke patient. Or you can also talk about the activity from the nurse during hospitalized, ya. Jadi bisa cerita tentang kenyamanan, bisa cerita tentang edukasi pada pasien dengan risiko stroke, bisa bagaimana emosional dengan nursing teori, misalnya adaptasi teori, atau bagaimana pasien mengantisipasi supaya hipertensinya stabil setelah hospitalized. Jadi itu banyak sekali yang bisa di show ketika kita mau report patient with nursing care. And then for this study is really great because have quasi experiment, so control patient and not control intervention and control group. However, the content is dietary approach. I think enough. I give to the moderator. Thank you.
Thank you very much for your review. May I kindly ask if you have any further question or feedback for participant?
Okay, can be a time to clarify Moderator?
Yes, you can.
Okay. Thank you. From the time I will be clarified about the duration of intervention. The duration of intervention dietary approach to stop hypertension in chronic disease patient is 2 weeks. So in the dialysis is four times dialysis.
2 times a week. Do you mean like this?
Yeah,
Okay.
2 minggu. Can I use bahasa Indonesia? Untuk penerapan dietnya ini sendiri itu selama 2 minggu. Jadi uh, untuk intervention group itu 2 minggu nonstop tetap melakukan dietary-nya. Sedangkan untuk di grup kontrolnya itu hanya edukasi terkait dengan penerapannya itu diserahkan kembali ke pasiennya. Untuk berarti untuk penerapannya ini selama 4 kali kunjungan hemodialisis, Ibu. Lalu untuk edukasinya terkait dengan konsumsinya seperti apa, cara pemasakan makanannya seperti apa itu sudah tertera di medianya. Untuk medianya itu bisa dicek di QR code yang ada di ujung kiri bawah posternya, gitu, Miss.
Oke.
Thank you.
Mungkin saya mau nanyakan, ini kan berhubungan dengan BI HD ya.
Nggih.
Adakah Anda konsultasi atau kerjasama kolaborasi dengan ahli gizi?
Untuk kolaborasinya itu kemarin saya kolaborasinya dengan teman saya di Gizi, Ibu. Jadi untuk menu-menunya sendiri dan cara pemasakannya itu saya sudah berkolaborasi dengan teman saya di ahli gizi di kampus 3, Ibu. Jadi insya Allah sudah bisa untuk diterapkan sehari-hari dan terbukti untuk penurunannya sangat signifikan di grup intervensi, Ibu.
Oke, nanti prinsip-prinsip itu ditaruh di langkah-langkah metodologi penelitian ya, karena itu adalah penerapan intervensi. Jadi intervensinya seperti apa itu harus dimasukkan di dalam metodologinya.
Yeah,
Gitu,
thank
ya.
you. Yeah, thank you. Bring back to moderator.
Thank you, the reviewers, and to Iqbal Lidin for your clarification. That concludes the poster presentation session. With that, I will now hand over to the event to measure our ceremony.
Okay, thank you, and Dr. Oendang and I, as reviewer, so thank you for the executive committee, Bu Dr. Nina, for this opportunity and for all students who to be committee. Thank you very much.
Once again, thank you to the reviewer, and thank you very much to Retika Flora Dwi Afifa for leading the poster presentation session. Ladies and gentlemen, after this, we will take a break until 12:35 p.m. So, ladies and gentlemen, please enjoy your break time, and please for all participants to join again, because we will return to our agenda at 12:35 p.m. Thank you. di ruangan ini pada pukul 12.35. Terima kasih.
Orang usah sih, orang usah tuh kancane kayak itu bener-bener gak sih?
Kalau cosplay, nah kan areng kene.
Turetika, the time is yours.
Thank you for Master of Ceremony for your opportunity. Ladies and gentlemen, we have now arrived at the main agenda, which is the scientific paper presentation session. Before we begin, let me briefly explain the rules and procedure for the scientific paper presentation. First, each participant will have 10 minutes to deliver their presentation. Second, after the presentation, there will be a 5 minutes question and answer session, during which the panel of reviewers may also provide feedback. Third, the next participant will be called once the previous session has finished. Before we proceed the oral presentation, allow me to invite the reviewers to come to the stage. For Associate Professor Dr. Arwani, Sarjana Kesehatan Masyarakat, Bachelor of Nursing Honors, Master of Nursing, and Dr. Sawab, Sarjana Keperawatan, Nursing, Magister Keperawatan. Please welcome. To begin the session, I would like to invite our first participant, Muhammad Zainal Abidin, Sarjana Keperawatan, Nurse Magister Kesehatan. You will have 5 minutes for your presentation. Sorry.
Okay.
You will have 10 minutes for your presentation, followed by 5 minutes for question and feedback from the reviewers. Please share your screen and start your presentation now. Your time begins now.
Sudah bisa dimulai?
Yes, you can do it.
Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Thank you, moderator, for your opportunity, for your time, and then is my voice clear? Can you hear my voice clearly? Yeah.
Clear.
Thank you. Thank you, and my honorable reviewer and moderator, my honorable reviewer, Mr. Prof. Dr. Arwani. How are you, Mr. Dr. Arwani? I think you're fine. And Mr. Dr. Sawab, how are you, Mr. Dr. Sawab? And also to the fellow participants of the oral presentation at the International Conference of NERCI 2025. Now, I would like to present my research results. The title is The Effect of Black Garlic on Reducing Blood Pressure in Clients in Families with Hypertension. My name is M. Zainal Abidin from Blora Nursing Program, Semarang Health Polytechnic. Now, the first slide is background. Hypertension is a global health problem, often a referral to as the silent killer. It can lead to stroke, heart failure, kidney failure, and blindness. According to World Health Organization, is 1.15 billion cases of hypertension in worldwide. According to Riskesdas, basic health research in Indonesia, the prevalence of hypertension in Indonesia at 2017 increased from 25.8% to 34.1% in 2018. Non-pharmacological therapies such as black garlic are a potential alternative solution alongside pharmacological therapy. Objective: to determine the effect of black garlic supplementation in reducing blood pressure in clients with hypertension in the family. This is a research interest in the area of family nursing. Next, the methods. The research was designed quasi-experimental with two group pre-post test with control group. Population is 40 hypertensive clients at Jetis and Banjarjo Blora Health Centers or Puskesmas. Sample is 20 intervention with black garlic and 20 control with placebo. Supplementation, black garlic and placebo given twice daily for a week. And then data analyze univariate, bivariate with Wilcoxon rank test. And then we can see univariate analysis the result before result that systolic blood pressure. Univariate analyze the result. In this study, the age of respondent in the treatment group was mostly 58 until 65 years. And in the control group, where the age of respondent is 45 until 55 years. The majority of respondents were female and the group male. Yeah. In the control group, had no family history of hypertension. 14 people in the treatment group and 13 people in control group. Most didn't take medication regularly. Now, result systolic blood pressure. Intervention group black garlic can decrease 23.4 mmHg with p-value less than 0.05. And then control group decrease 1.84 mmHg with p-value less than 0.05. And then results diastolic blood pressure. Intervention group black garlic can decrease 16.33 mmHg with p-value less than 0.05. And then control group decrease 1.29 mmHg with p-value less than 0.05. Now, we can see the diagram or graphic show that result systolic blood pressure. We can see intervention group decrease 23.4 mmHg. Control group decrease 1.84 mmHg. And then diastolic blood pressure intervention group also decrease 16.33 mmHg, and then control group decrease 1.29 mmHg with p-value 0.0705. But group experience a decrease in systolic and diastolic, but the intervention group experienced a significant reduction.
Pardon me for interruption. You have 2 minutes remaining for your presentation.
Okay, thank you. Discussion. How is black garlic can reduce lowering blood pressure? The research, the content black garlic is salyl cysteine atau SAC, flavonoid, allicin, and hydrogen sulfate in black garlic, where allicin is useful for blocking the activity of angiotensin 2, flavonoid, and hydrogen sulfate can dilate blood vessel, which can control blood pressure so that it can lower blood pressure according by et al. 2014. The more research has proven that black garlic can lower blood pressure with p-value less than 0.05, according Budi Setiawan. So the conclusion is black garlic can decrease systolic and diastolic. Okay, its time is up. Thank you, Ms. Moderator.
Thank you
Okay, the
to
time is back
Muhammad.
to Moderator, Ms. Moderator. Thank you.
Okay, thank you to Muhammad Zainal Abidin for your presentation. That was a great presentation. We will now proceed with a question and answer session and feedback from the reviewers. To the reviewers panel, please proceed.
Aku tulis ya.
Yes. Okay. Is my voice clear, Mr. General Abidin?
So clear, Mr.
Okay,
From
thank you.
Arwani.
Yes, okay. First of all, congratulations for Mr. General Abidin for your wonderful presentation.
Thank you. You're welcome.
Yeah. All right. Okay. So this is experimental research, right?
Right. Quasi-experimental.
Okay. My first question is, did you have a novelty of your research? Or can you explain what is the novelty of your research?
The novelty in my research is the sediaan black garlic itu kita buat dalam bentuk yang lebih menarik, Prof. Jadi selama ini black garlic itu tersedia itu dalam bentuk sediaan original. Ini kita buat dalam bentuk substitusi ke dalam permen, begitu, Prof. Sehingga diharapkan nanti produk bisa memberikan impact luas bagi klien hipertensi di keluarga untuk bisa memanfaatkan sediaan ini.
Okay, because this is some like that should be consumed by the human being.
So in terms of dosage, yeah. So how much doses, for your experimental research? Because you have already stated that this is only 1 week, isn't it? So you did your research, it's only 1 week. Do you have any reason?
Okay.
Is it based on a previous research or something like this?
Ya, sediaan kita formulasikan dalam dosis di 250 mg. Sebenarnya riset saya itu ada eksperimen empat perlakuan, Prof. Jadi ada dosis 250, kemudian 450, ekuivalen 500 mg, kemudian di 900 mg. Kemudian masing-masing itu bahwa black garlic itu komponen utamanya adalah hasil
Yeah, okay.
itu
I think it's clear, but I think it's better for you, if you have to mention about the variety of dosage, because you didn't mention about the dosage. Yeah, it's quite important for the researcher. Yeah, when you did something like this, for example, you give a dosage to your client or something, but I think it's important for the researcher should mention about how many doses, how many dosage that you give to the client. Even you say that this is different dosage. Yeah, so this is you have to mention it in your research report, I suppose. Last question. Yeah, last question. Yeah, as far as I know that there are so many factors that influence on hypertension. Yeah.
Yeah.
Okay. So how did you what we call this maintain? How did you maintain the factors that will influence on the dependent variable, like this is in terms of hypertension? How did
Okay,
you maintain? How did you control the factors?
Excuse me for interrupting. The Q&A session has 30 seconds remaining.
ya.
Okay.
Saya mencoba mengurangi faktor-faktor risiko yang membuat bias dengan cara kriteria inklusi kita perketat dengan bahwa pemilihan responden itu adalah with essential hypertension, without tanpa ada penyulit atau penyakit komplikasi lain. Kemudian mereka juga kita berikan informed consent untuk bahwa mereka hanya menggunakan black garlic ini. Jika mereka menggunakan obat, maka kemudian sementara waktu tidak diminum, dengan catatan bahwa semua responden saya essential hypertension dengan grade 1.
Okay, thank you.
Thank you.
Thank you to the panel of reviewers for the valuable questions and feedback, and to the first participant for your responses. That concludes the first participant session. Next, I would like to invite Adele Violia Pratiwi, Sarjana Terapan Keperawatan, nurse, as our next presenter. You will have 10 minutes for your presentation, followed by 5 minutes for questions and feedback from the reviewers. Please share your screen and start your presentation now. Your time begins now.
Oh, I see. Okay. Sorry.
Sorry, Can I share screen? Okay, Adele Violina, your time begins. Okay, thank you for the opportunity. Good afternoon, everyone. I'm delighted to be here at International Nursing Conference. My name is Adele Violia Pratiwi. Today, I will present our research entitled Implementation of Alarm Puzzle, Media on Compliance in Taking Antituberculosis Pulmonary Medication in Children at RSUP Dr. Karyadi Semarang. Next. The first for the background, tuberculosis or TB is a global health challenge, particularly in children. In Indonesia, childhood TB account for around 8 to 12% of reported TB cases. And one of the biggest challenges in TB management is medication adherence. Incomplete or irregular treatment not only increases the risk of treatment failure, but also leads to multi-drug resistant TB, which is much more difficult and costly to treat. Children, especially in the preschool age group, often face difficulty in maintaining consistent adherence. This may be due to forgetfulness, lack of motivation, or limited understanding of the importance of taking medication. Play-based learning strategies such as puzzles are known to encourage children's participation, enhance engagement, and reduce boredom. Therefore, we developed an innovation called the alarm puzzle. This is a simple yet engaging tool designed to integrate play into the process of taking daily TB medication. Our goal was to examine whether this media could support children's treatment compliance. Okay, next for the research methodology, we use a descriptive case study design guided by evidence-based nursing practice principles. The study was conducted at RSUP Dr. Karyadi Semarang with 3 pediatric patients aged between 5 and 12 years, all diagnosed with pulmonary tuberculosis. And with inclusion criteria where children who had just started treatment, willingness to participate, and parental consent. The alarm puzzle consists of 30 puzzle pieces, each piece representing 1 day of TB medication. After successfully taking their medication, the children were allowed to attach 1 piece to the puzzle. This process was carried out for 5 consecutive days. We collected data through direct observation of medication taking, behavior, and interviews with both children and their family. And then puzzle design. The puzzle are designed in a booklet. Sorry, next slide. Okay, the puzzle are designed in a booklet. The title of the puzzle is written on the front page, followed by a picture of TB toss on the second page. And then the third page contains puzzle pieces that children can glue together according to the treatment. The final page includes the process you can do it to motivate children throughout the treatment process. Next, let's move on the result and discussion. Our findings show a positive improvement in medication.
Sorry, my signal is lost. Okay, next. Let's move on the result and discussion. Our findings show a positive improvement in medication adherence among all 3 children. The first, before the intervention, adherence was irregular. The children often forgot to take their medicine, showed low motivation, or were easily distracted. And then after using the alarm puzzle, adherence significantly improved. The children became more consistent in taking their medication on time and demonstrated visible enthusiasm in completing the puzzle. This shows that the alarm puzzle act not only as a reminder system, but also as a motivational factor. The gamified element of completing a puzzle piece provided satisfaction and encouragement for the children. For the discussion is from this small case study, we observed several important points. The first, the alarm puzzle is effective as a visual and interactive reminder. It combines health behavior with play, which is highly relevant to children's development stage. Second, this approach was particularly effective in preschool age children between 4 and 6 years. They perceive the puzzle as fun and engaging. However, for older children aged 6 to 12 years, the puzzle was perceived as less interesting, which might reduce effectiveness. And third, we found the parental involvement was critical. Parents play a key role in reminding, encouraging, and supporting their children in completing the puzzle and maintaining adherence. Our findings are consistent with previous studies that highlight the value of gamification and family-centered approach in chronic disease management for children. Nevertheless, our study had limitations. The sample size was very small, only 3 children, and the observation period was relatively short, only 5 days. Therefore, the results should be interpreted with caution and cannot be generalized widely. And then in conclusion, the use of the alarm puzzle media has shown promising results in improving adherence to TB medication among children, particularly in preschool age groups. This media provides a structure, enjoyable, and motivating experience, transforming the stressful routine of taking medicine into a playful and rewarding activity. It serves as both a visual reminder and an educational distraction. However, to confirm its effectiveness, we recommend conducting further studies with a larger sample size and longer observation period. The integration of family support and gamification strategies can be a valuable addition to pediatric TB care. Okay, next, here are some of the reference we use in our research. Okay, thank you for your attention. I return it to the moderator.
Thank you to Adele Violia Prativi for your presentation. It's a great presentation. We will now proceed to the Q&A session. May I kindly invite Dr. Sawab to share his review, which will be followed by a review from Mr. Arwani. Dr. Sawab and Professor Arwani, please proceed.
Thank you. Thank you, Mr. Arwani. Thank you, moderator. Proud of you. Adele Viola Prativi. Proud of you, Adele. Good presentation. Miss Adele, this is an interesting case study on improving adherence in TB patient. Adherence is a problem for the TB patient undergoing treatment. Miss Adele,
Has there been a previous research on the topic since? Miss Adele?
Sorry,
Hello,
sir.
Miss Adele.
Can you repeat? Can you repeat?
Okay, Miss Adele, can you explain? Has there been any previous research on the topic same about puzzle for adherent in TB patient for children? Badel, ada penelitian sebelumnya yang meneliti tentang penggunaan puzzle untuk kepatuhan pengobatan TB.
Iya, ada Bapak.
Oke. Oke.
Ya.
Oke. Mbak Adel, pada penelitian sebelumnya bagaimana?
Untuk penelitian sebelumnya berhasil, tapi pada orang dewasa, Bapak. Jadi saya membuat inovasi kepada anak-anak yang kebetulan dalam kepatuhan minum obatnya itu masih kurang, seperti itu.
Oke, it's good topik, ya. It's good keaslian penelitian. Adele, can you explain about what it causes children with TB not comply with medication? Oke, Mbak Adele, dari beberapa yang dibaca, kira-kira anak-anak dengan TB tidak patuh minum obat, penyebabnya apa yang Mbak Adele baca selama ini?
Oke, Bapak, terima kasih untuk pertanyaannya. Jadi untuk selama saya penelitian itu, saya sempat mewawancarai anak-anak yang menjadi sampel saya, yaitu yang menjadi penyebab utama dalam mereka tidak patuh dalam pengobatan TB itu biasanya karena bosan, Bapak, karena bosan karena minum obat selalu terus-menerus, lalu dengan ada beberapa anak juga dikarenakan efeknya yang kadang kan ada mual terus membuat tidak bisa makan seperti itu, Bapak. Jadi ya bosan dan karena efeknya seperti itu. Karena rutinitas yang terus-menerus.
Oke. It's good reason. Artinya, Mbak Adele, apa yang Mbak Adele praktekkan adalah untuk meningkatkan ketertarikan dengan bermain puzzle. Oke?
Ya, betul, Bapak.
I think in this reason for Adele to make it more comprehensive for in article you can add some of input beberapa tadi yang kita berikan masukan untuk Adele. Oke, I think enough, Adele. Congratulations.
Baik, Bapak. Terima kasih, Bapak. Thank you so much.
Thank you to the reviewers and the second participant. That concludes the second session. Now we move on to third participant. Next, I would like to invite Dandita Ratu Permata, Sarjana Terapan Keperawatan, as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Okay, is my voice clear?
Yes, it's clear.
Okay, thank you for your opportunity, moderator. Let me share my screen. Sorry, Miss, I cannot share my screen. Okay. Good afternoon, the honorable reviewers, Mr. Professor Dr. Armani and Mr. Dr. Salap. Please allow me to introduce myself. I'm Dendita Ratu Permata from Poltekkes Kemenkes Semarang, and now I'm undergoing the nursing profession on Karyadi Hospital. It is a great honor for me to be here today to present my research in this NERCI event. With respect and gratitude, I would like to deliver my research under title Endorphin Massage and Kinesiotapping as Effective Intervention for Reducing Lower Back Pain Intensity in Trimester Pregnant Women at Prowosari Health Center. Next. For the background, the lower back pain is one most common complaint during pregnancy, affecting 60 until 80% of women in the third trimester. This condition is mainly caused by postural change, weight gain, and hormonal shift, particularly the increase of relaxin and estrogen, which loosen ligament and joints, leading to instability and discomfort. Impact of low back pain is not only psychical but also psychological. It often disrupts sleep quality, limits mobility and daily activities, increase stress level, and decrease overall quality of life. If it left untreated, it may even persist after delivery or in subsequent pregnancies. Pharmacological treatment options are limited during pregnancy due to potential risk for the fetus. Therefore, non-pharmacological interventions are considered several alternatives. Two promising methods are endorphin massage and kinesiotapping. Endorphin massage is a gentle technique that stimulates the release of endorphin, the body's natural painkiller. Meanwhile, kinesiotapping works by supporting muscles, improving blood and lymphatic circulation, and decreasing muscle tension, all without any harmful impact on the fetus. Next. The objective of this study to determine the difference of effectiveness between endorphin massage and kinesiotapping in reducing the intensity of low back pain among third trimester pregnant women. Next. The method it's using in this research, the design is quasi-experimental, using pretest and post-test with control. For the sample, I'm using 40 person third trimester pregnant woman, which divided into two groups. The first group is given endorphin massage, and the second group is given kinesiotapping. The instrument that using in this research is numeric rating scale that applied in the observation sheet. Next. For the research, the table 1 show the characteristic of respondent at Prowosari Health Center. All participants were in each of group of 20 until 35 years old. Based on the gravity, 40 were primigravida and 60% were multigravida. Regarding occupational status, 35% of respondents were working, while the majority, 65%, were not working. The distribution between the intervention and control group was balanced and across all the categories. The table 2, the results show that this finding is consistent with Astuti et al. 2022, who found endorphin massage effective in reducing low back pain, and Sulistianingsih and Sari 2023, who reported a significant decrease after 4 weeks massage. Handayani et al. 2020 also confirmed that none of mothers reported severe pain after receiving endorphin massage. For the table 3, the kinesiotapping also demonstrated a significant effect at baseline. 95% of respondents had moderate pain and 5% mild pain. And after giving the intervention, 90% experienced mild pain and 5% had no pain. These findings are in line with Putri et al. 2023, who showed that kinesiotapping reduced pain by stimulating skin mechanoreceptor and providing muscle support. Similarly, with Sulastri et al. 2023 reported 2 until 4-point pain reduction after 4 days of tapping. Next, please. This result in table 4 confirmed a significant decrease in pain intensity after both intervention. The results of the study are in line with Handayani et al. 2020, which show almost half, 45% of all pregnant women experience severe pain, and after giving the intervention, none of the respondents experienced severe pain with the value 0.00. Experimental research by Chan Nakrom et al. 2021 also support these findings, stating that kinesiotaping effectively reduces low back pain significantly. Next. The table 5 showing comparison of pain reduction between the intervention group for the endorphin massage and the control group is kinesiotaping. The higher mean rank in the endorphin massage group showed that overall the pain reduction score in this group was greater compared to the kinesiotaping group. From an accessibility perspective, endorphin massage is practical, requires no special tool, and can even be taught to families or partners. On the other hand, kinesiotaping needs professional skills and carries a risk of skin irritation if applied incorrectly. Overall, while both interventions are effective, endorphin massage offers faster relief, emotional support, and better accessibility, making it more optimal choice for pregnant women with low back pain in the trimester. Next. The conclusion, based on the result of the study, both endorphin massage and kinesiotaping was proven effective in reducing the intensity of low back pain among trimester pregnant women at Rawesari Health Center. The Wilkerson test confirmed a significant decrease in pain intensity in both groups. Further comparison using the Mann-Whitney test demonstrated a significant difference between two interventions with p-value less than 0.05, with endorphin massage showing greater effectiveness with mean rank 30.50 compared to the kinesiotaping with mid rank 10.50. Supporting evidence from previous studies also indicates that endorphin massage stimulates endorphin release, providing natural analgesic and comfort, while kinesiotaping reduces muscle tension and improves circulation. In conclusion, both methods are safe and beneficial as non-pharmacological intervention, but endorphin massage emerged as the more optimal technique for reducing low back pain in trimester pregnant women. Thank you so much. That's for all my. Thank you for your attention. I'll give it back to the moderator.
Thank you, Dr. Ratu Permata, for your presentation. That was a great presentation. We will now proceed to Q&A session. One question from Mr. Arwani and one question from Dr. Sawab. To Dr. Sawab and Professor Arwani, please proceed.
Okay, thank you. Dantita.
Yes,
Dantita Ratu Permata, congratulations. It was wonderful presentation. Yes. My first question is, why did you combine the therapy, both endorphin massage and kinesia? What kind of kinesiotaping? Yeah. Why did you combine it? Is there any particular reason?
Okay,
Is
thank you
there
for
any different when you did only one of both therapies, or you have to combine to do this to your client?
Okay, thank you for your question, Mr. Arwani. But for the clarification, I did it one treatment for one group. So the first group is given endorphin massage and the other group given the kinesiotap. I'm not combine it, I'm comparison. Just to clarify.
Yeah,
And
so my question is, do you have any reason why you do both, so not one? And which one given to your control group and which one given to your experimental group?
okay, thank you for your question. Kenapa tidak dikombinasikan? Kenapa satu-satu grup?
No. So yeah, this is my question, please pay attention. Why did you combine? So in your research is combine both therapies or one by one?
One by one, Mister.
Right.
Sorry.
One by one. So which one in control group and which one in
The
experimental group?
intervention, the experimental group in given endorphin massage and the control group given the kinesio tapping, Mister.
All right, okay. So do you have any reason why in control group you did kinesiotherapy? I think when the researcher give something to the control group, it's mean that the intervention or activity should be performed daily as a part of the management of what we call this is pain or something like this. So is kinesio is a part of daily living of your client. Or both of your research is experimental group.
Bisa bisa dibilang berarti untuk both of endorphin massage and kinesio tapping termasuknya ke dalam eksperimental, Mister.
Okay, so the two therapies are experimental. Yeah. Okay, so you didn't have a control group in your research.
Okay, Mister.
Yeah, I think it's better for you if you mention if your article what was your limitation in your research.
Okay, Mister.
Okay. Thank you.
Thank you, Mister.
Anytime, moderator?
Yes, may I now kindly ask if you have any further question or feedback for participants?
Okay. Dani Tita. Hello, Dani Tita.
Hello,
How are
Mr.
you?
Salap. I'm really good.
Okay, good presentation.
Thank you.
Proud of you, Miss Dani Tita. Tita, why is it important to compare this therapy, endorphin message and
And
therapy?
kinesio
Please explain.
tapping.
Okay.
Okay, because on the previous journal or previous research, I'm tidak melihat ada yang sudah membandingkan between the endorphin massage and kinesio tapping. And also for the specific respondent, the third trimester, there is no previous journal or research that have been doing it, Mister. So I took that reason for compare between the endorphin massage and kinesio tap.
Okay, it's good. Please include this in the discussion. Okay, thank you, Miss Dani Tita.
Thank you so much.
Selamat dan Tita.
Terima kasih, Bu Nia.
Thank you to the reviewers and to the third participant. That concludes the third session. We now welcome the first participant to present. I would like to invite Latifah Anik Adawiyah as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Okay, thank you for the moderator for the opportunity. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Latifah Nikadawia from Poltekkes Kemenkes Semarang. Here, I would like to present the result of my research entitled Analysis of Factor Associated with Artery-Venesan Aneurysm in Hemodialysis Patients. Next. Patient undergoing hemodialysis therapy required adequate vascular access to ensure that vascular access can last longer with minimal complication. One of the vascular access with minimal complication and more often used in long-term hemodialysis is artery-venesan. Vascular access characterized by the enlargement of all three layers of the blood vessel wall beyond 18 mm in diameter is referred to as aneurysm formation. The prevalence of aneurysm in several countries range from 0.46% to 60.7%. The highest incidence of aneurysm occurred in one of the district hospitals in Indonesia with a prevalence of 60.7% and the lowest prevalence of aneurysm at 0.46% was found in India. Some of the studies explain that the same repeat puncture causes aneurysm, and the incidence of aneurysm was found to be lower in patients who allow the needle entry site to be changed. However, several other factors may also influence aneurysm formation. The next. Okay, the objective in this research is what factors are associated with the incidence of aneurysm in the AFESAN in patients undergoing hemodialysis. Next. Okay, in this study, employ a descriptive correction design with a cross-sectional approach. The study population consists of 51 patients undergoing hemodialysis at Dr. Kardi Hospital, and the total sampling technique was used with a sample selection based on specific inclusion and exclusion criteria. And the data analysis was performed using simple linear regression and multivariate linear regression. And the next. The next is result from my study. The study was conducted from April to May 2025 with a sample size of 34 respondents who meet the inclusion and exclusion criteria. From the data, among 34 respondents, the predominant age group among respondents were late adult with age 36 until 45 and early elderly respondent aged 46 until 55, each comprising 9 respondents. And then for the majority exhibit comorbidities related to hypertension with 14 respondents. And then for the length of fistula use, majority reporting using an AFESAN for a duration of 13 to 24 months with the respondent 12 respondents. And then for the cannulation technique, all the respondent is using puncture area cannulation for AFESAN procedure during hemodialysis. Okay, the next is the data from aneurysm. Among 34 respondents, the finding indicate that a majority of the respondents, specifically 19 respondents with the percentage 55.88% did not experience aneurysm, while 15 respondents with the percentage 44.1% report experience a various type of aneurysm. The most prevalent type was type 1A, observed in 6 respondents with percentage 17.6%. Next. Next. Sorry, can PPT be next slide? Okay, the next is the result from bivariate analysis. The finding from the symbolic linear regression suggests that age does not have a statistically significant impact on the incidence of aneurysm with Afesan, with the p-value 0.167, which is greater than threshold of 0.05, with the correlation coefficient determinant 0.243, and then for coefficient determinant 0.059, suggesting that it account for only 5.9% of variance in aneurysm occurrence. These results are consistent with the research conducted by Kawaja 2024, which also found no significant difference in the incidence of fistula aneurysm based on age with p-value 0.255. Next. The finding from comorbid disease suggests that comorbid significantly influence the incidence of aneurysm in Afesan pathway, with the p-value 0.012 and the correlation coefficient 0.424 with coefficient determination 0.180, suggesting that comorbid account for 18% of the incidence of aneurysm. This finding align with the research conducted by Rosu 2025, which demonstrate that patients with hypertension have increased likelihood of aneurysm dilation with odds ratio of 1.80, indicating a stronger associate. Next. The next is the finding from the length of visual use suggests that significantly affect the incidence of aneurysm in the Afesan pathway, with the p-value 0.006, which is less than 0.05. From the correlation coefficient was calculated to be 0.465 and coefficient determination 0.216, suggesting that the length of visual use account for 21.6%. These results of the study are in line with the result of study conducted by Kawaja 2024, which showed that the patient who experienced arteriovenous fistula aneurysm usually had a longer duration of Afesan use. The next. Okay, the next is multivariate analysis. Based on the finding, indicate that three variables, which mean age, comorbidities, and length of visual use, exhibit a statistically significant associate with the occurrence of aneurysm, with the regression coefficient for this variable were 0.373 for age, 0.515 for comorbidities, and 0.359 for visual use. And then for coefficient determination, calculate to be 0.663. For the S-square value in this study is 0.440, indicating that 44% of this variability in aneurysm incident can be accounted for by three variables included in this model. And
Remy, for closing, you have 1 minute remaining for your presentation.
Okay, based on the result multiple linear regression, comorbidity had the strongest influence of the incident aneurysm with the highest coefficient value and the p-value 0.005. This means that the presence of comorbid significantly increased the risk of aneurysm in patients with Afesan. And then for R value, indicating that 44% of the variant aneurysm occurrence. And then this means that present comorbidity significantly the risk of aneurysm in patients with Afesan. Next. The next is conclusion. Based on the finding analysis present on this study, the prevalence of aneurysm in arteriovenous was 44.1 among hemodialysis patients at Dr. Kadi Hospital. And then for bivariate analysis, revealed no statistical significant associate between age and occurrence of Afesan aneurysm in patient population. And then multivariate analysis indicating a significant relationship between age and incidence of Afesan aneurysm. And then additionally, the present comorbidities was significantly associated with the development of Afesan aneurysm, and then the duration of visual use also demonstrate a significant correlation with aneurysm incident. Also, Practically, analysis of decumulation technique was not feasible due to data homogeneity. Theoretical consideration such as a potential relationship between cannulation method and aphasia aneurysm formation in hemodialysis patient. Among the factors examined, comorbidity emerged as the most involved variable associated with aphasia aneurysm occurred as evident by p-value 0.005. Thank you.
Thank you to Latifa Anik Adawiyah. We will now proceed with the Q&A session. One question from Dr. Sawab and one question from Mr. Arwani. To Dr. Sawab and Professor Arwani, please proceed.
Yeah. Okay, thank you, moderator. Latifa, hello Latifa.
Oke, Bapak.
Okay, congratulations Latifa. Your PowerPoint presentation is a very excellent. Latifa,
Yes.
one question for you. What are the implications for your research for nurses who reach this result? Latifa?
Yes.
Hello.
Wait.
Okay, once again Latifa ya.
Yes.
Okay, what are the implications of Latifa research for nurses who reach this result?
Okay, maybe from my research, this can be in judging nursing care, particularly in the selection of conversion technique and rotation of puncture site and early visual assessment for sign of aneurysm. Nurses are occur to provide continuous education to patients regarding the importance of self-examination and self-care for aphasia.
Okay, good answer. Latifa, once again, from the result of the study, comorbidity is most common cause. Okay.
Yes.
What are the implications for the future research?
Okay. For comorbidity.
Latifa?
Mungkin
Okay.
untuk selanjutnya comorbidity saat ini mungkin bisa untuk sebentar Bapak.
Hello.
Oh ya.
Miss Latifa?
Saat
You
ini,
okay?
yes, I'm okay.
Okay.
Saat ini peralatan
Okay, no worries, Miss Latifa.
Yes.
I think your presentation is okay, and then so we'll add what I mentioned earlier to this article. Congratulations for Miss Latifa, and then for Mr. Rafi, please.
We have any time. Time is up. Lempar banget. Okay. Hey, Latifa. Latifa, can you hear my voice?
Yes, I can.
All right. Okay. I think it was good presentation. You have already mentioned every single thing clearly, but I have a question. Yeah. I do believe that the similar research or similar study have already conducted previously. Yeah. So my question is, what is the difference between your research and the previous research?
Okay, the first in my research just using 3 dependent variable and 1 independent variable. And the location untuk lokasinya saya melakukan penelitian di Indonesia, sedangkan untuk penelitian sebelumnya kebanyakan ini dari penelitian di luar negeri. Dan untuk penelitian di Indonesia ini masih sangat jarang.
Right. The subject is similar.
This is for hemodialysis client or
Oke.
other.
Untuk responden dalam penelitian saya ini termasuknya sangat kecil, hanya 34 responden yang memenuhi syarat inklusi dan juga eksklusi kriteria.
Right,
Untuk
okay.
penelitian sebelumnya itu respondennya bermacam-macam hingga
Okay, Latifa, well done. Thank you.
Thank you to the reviewers and to the fourth participant. It was the end of the oral presentation. For Dr. Sawab, please return to your seat.
Okay, thank you so much. Nice to meet you. Okay, thank you. No problem.
Ladies and gentlemen, before we move on to the next participant, we would like to invite the next reviewers. For Dr. Sri Endang Windiarti, Sarjana Keperawatan, Nurse, Magister Kesehatan, please welcome. Next, we invite Puguh Rajendra Prakoso as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Good afternoon. Thanks for moderator and thanks for the judges. And today I want to like to presentation about my research about the relationship of the nurse's knowledge level with double-lumen catheter, vascular access care practice in hemodialysis patient, a cross-sectional study. Next. For my research to focus on in hemodialysis therapy. In hemodialysis therapy and focus on the vascular access is several of the essential pathway for the blood circulation for the patient. The double-lumen catheter is often employed in the urgent or temporary situation, carries a considerable risk of the central line associated bloodstream infection. Therefore, appropriate nursing care of vascular access plays a critical role in preventing complication and ensuring treatment effectiveness. So, nurses as the key provider of such care needs sufficient knowledge to maintain catheter safety and functionality. Next. For the objective for my research, this study aimed to determine the relationship between nurses' knowledge level and their practice in managing vascular access for hemodialysis patient. The method I use is quantitative design involving 25 nurses from the hemodialysis unit at Dr. Karyadi Hospital Semarang to use a cross-sectional study, and the data of knowledge and the practice care were obtained using questionnaire and analysis with the Spearman rank correlation test. Next. For my result study for the nurses' knowledge level in Dr. Karyadi Hospital Semarang have indicated the good in the level of knowledge. For the mean is 8.16 and the subscale for the level of knowledge of the knowledge vascular access principle have the level good, and the infection prevention and vascular access safety in the nurses in the good level, but in the knowledge management complication in the moderate level. Next.
On the vascular access care in the nurses in the Dr. Karidi Hospital Semarang have the good level in the all subscale in infection prevention, in vascular access, monitoring and infection prevention, and also in the complication management vascular access. Next. On the bivariate test, the relationship between nurses' knowledge level and development hemodialysis vascular access care practice at Dr. Hospital Karides Malang. This indicated the statistical analysis demonstrate a strong positive correlation with R 0.846 and between knowledge level and the vascular access care practice with p-value 0.00. This is indicating statistical significance. Next. For the result, we can discussion about the strong relationship that a significant positive correlation was found between nurses' knowledge and the vascular access care practice for the double lumen catheter. The higher knowledge for the nurses leads to better care for the patient. For the KAP theory on the knowledge, attitude, and practice theory, that knowledge from the foundation for the nurses to positive attitude and effectivities clinical practice. For the previous study, for my research online in Yusrita et al. 2022, that nurses' knowledge of vascular access is essential to prevent infection and thrombosis, ensuring patient safety and improving the quality of life for the patient. And also for the Huang Liu 2024, that knowledge directly influence attitude practice with significant indirect effect through attitude, highlighting the importance of continuous knowledge to improvement. Also, the guideline relevant for aligned with the CDC 2022 and Potter and Perry 2017 that emphasizing that staff education, septic technique, and strict protocol adherence to prevent clepsy on the patient hemodialysis. So the implication for the nurses to continuous training and structured education program are needed to strengthen nurses' knowledge and the transit to into the safe activity and the patient-centered care. Next. So for the conclusion for Marisa to the finding highlight the better knowledge among the nurses is associated with improvement vascular access care in patients undergoing hemodialysis, but needed structured training program and ongoing education are therefore recommended to strengthen nurses' knowledge and enhance patient outcomes. Next. Thanks for my presentation. I'd like to moderator.
Thank you to Guru Rajendra Prakoso for your presentation. We now proceed with the Q&A session. One question from Dr. Sri Endang and one question from Professor Arwani. Please proceed.
Okay, very excellent your presentation. Mas Puguh ya. Hubungan pengetahuan perawat terhadap perawatan double lumen kateter vaskuler, ya. Saya dengan bahasa Indonesia ya, Mas. Oke. Tadi di hasil yang saya harapkan memang adanya karena di sana adalah hubungan tingkat pengetahuan, ya. Saya harapkan hasilnya di sana adalah mengetahui tingkat pengetahuan perawat. Nah, yang terakhir itu ada poor knowledge 0%, moderate knowledge 9,369%, 9,36%, and good knowledge 16,64%. Artinya, kalau mau menjadikan perawat itu pengetahuannya tinggi, apa yang harus dilakukan, Mas Puguh? Karena di sini yang moderate, yang lumayan banyak juga, harusnya kan good good knowledge.
Thanks for the question. How about to improve the moderate knowledge of the nurses? For the based on the cases in the doctor care di Hospital Semarang, the higher volume for the patient also can be effect to the workflow for the nurses. So it can be difficult for the nurses in doctor care di Hospital Semarang, but we can to improve with the seminar training or maybe to evaluation for the caring for the patient in the treatment in the hemodialysis catheter development, Miss.
Okay, thanks. Untuk selanjutnya, Pak Dr. Arwani.
Alright, okay, yeah. Mas Buku, yeah, congratulations. Okay, Mas Buku Rajendra Prakoso, yeah. So this is a cross-sectional study. Yeah, you have already mentioned about the questionnaire you use in your research. Yeah, this is about knowledge level, and the second one is about vascular access care. Yeah. Okay. Based on the theory, is it direct correlation between knowledge and practice or indirect question? Indirect relation. Mas Buku, can you voice?
Yes.
Yeah, my question is, you have already examined two variables, knowledge level and practice about what we vascular access care. Knowledge and practice, based on your mind, is it direct relationship or is it indirect relationship?
For the literature, for the knowledge and the practice have a direct relationship. But why I chosen the title of for my research, because in the Karya di Hospital Semarang on the previous study just mentioned about the hemodialysis nurses in the general knowledge, but still few in the focus on the level of knowledge in the preventing vascular access care, Mr.
All right, okay, yeah. Yeah, in general, knowledge and practice is not direct relationship. So between knowledge and yes, between knowledge and practice will be attitude or something like this. Yeah. However, you have already mentioned two questionnaire you use. I think is very good because you have already explained about the validity and reliability of the question. All right, but you have to discuss, add discussion, because knowledge level and practice is not direct question. So I think based on the theory, yeah, you can add information before taking action or something like this, then someone should has attitude level or something like this. Yes, so you can add it in your journal article. All right, okay, by and large it's good. Thank you.
Yes, thank you for the suggestion, Dr. Arwani.
Yep.
Thank you to the reviewers and to the fifth participant. That concludes the fifth session. We now move on to sixth participant. I would like to invite Fariza Lukman Rashid, Sarjana Terapan Keperawatan, as our next presenter. Please share your screen and start your presentation now. Your time begins now.
Thanks for moderator. And before this, I want all to help to share my presentation. Okay, thank you. Good evening, everyone. I'd like to begin expressing my gratitude to Dr. Nina, Dr. Endang, and Dr. Awani for review. My name is Fahri, and today I will be presenting our study on intradialytic exercise as a nursing intervention to reduce fatigue in hemodialysis patients. Next. To begin, let's look at background. Chronic kidney disease, or CKD, is a significant and growing global health issue. In Indonesia specifically, we're seeing an increasing number of patients who require hemodialysis as their life-sustaining treatment. And while hemodialysis is essential for survival, it comes with a major challenge. It is fatigue. This isn't just a minor complaint. It's a profound and distressing symptom that affects up to 86% of patients. And fatigue not only severely impacts their quality of life, it can also compromise the effectiveness of their treatment. As some patients might even terminate session early due to discomfort. However, a promising solution has emerged. Evidence strongly supports intradialytic exercise, that is exercise performed during the dialysis session, as a safe and effective way to alleviate this fatigue. Next. Okay. This led us to the main objective of our study. We aim to evaluate and the effectiveness of intradialytic exercise as a nursing intervention to reduce fatigue in CKD patients right here in our clinical setting. Next. Okay, for our research, we used a pre-post case study design. This means we measured the subject's condition before and after an intervention on a small sample. Our participants were 3 patients aged between 18 and 60 years old. We are undergoing routine hemodialysis and experiencing moderate to severe fatigue. The intervention itself was straightforward. We had the patient perform structured light to moderate exercise for 15 to 30 minutes during their dialysis session. This was done 2 times within 1 week. To measure the impact, we used the fatigue scale, assessing their fatigue level both before and after each exercise session. Next. Now, let's get to our results. We found a very clear and consistent pattern. Our key finding was that intradialysis exercise resulted in a consistent reduction in fatigue scores across all 3 patients. Looking at the objective data, the mean fatigue score dropped from 24.83 before the intervention to 20.50 after 2 sessions. This is a measurable and significant improvement. In the numbers, the subjective feedback from our patient was equally complete. Next. Our findings are strongly supported by existing literature and alleged with previous studies, confirming the effectiveness of intervention. And we believe this happens through a dual mechanism. The first is physiological mechanism. Exercise improves blood flow and muscle oxygenation, which help clear metabolic toxins like lactic acid. This directly reduces physical fatigue and muscle soreness. And the second is psychological mechanism. In this activity, break the monotony of the dialysis routine. It gives patients a sense of empowerment and active participation in their own care. And together, these mechanisms explain the significant reduction in fatigue we observe. Next. In conclusion, our study demonstrates that intradialytic exercise is a feasible and highly effective nursing intervention for managing fatigue in hemodialysis patients. This evidence-based practice should be integrated into routine hemodialysis care to ensure patient well-being. Okay, thanks for your attention.
Sorry, Fahriza, are you finished?
Yes.
Okay, thank you to Fahriza Lukman Rashid for your presentation. We will now have the Q&A session. One question from Dr. Sri Endang and one question from Professor Arwani. Please proceed.
Okay, well, thank you very much, moderator, and good luck to Fahriza Lukman Rashid. Has already presented your presentation very well. Yeah. So this is my question. So your research is absolutely descriptive one, isn't it? Because only 3 clients in your research. Yes?
Yes, Mr.
All right, okay. So you didn't mention about the kind or the type of exercise. So what kind of exercise did you do to your client? Is that a clear question?
Okay. This is conducted is a type of implementation study or evidence-based practice project.
Yeah, so my question is what kind? So you have to mention, you have to give enough information about the exercise that you did to your client. Because when I read in the method in your article journal, in journal articles, there is no information about the kind of exercise. So I think you have to add information about the kind of exercise. Yes.
Oh yes, this is a flexibility exercise, Mr.
Yeah, all right, okay. In which paragraph, in which sub chapter, method or something?
Oh yes, I not write it in
Right, okay.
PowerPoint. Yes.
So you didn't mention about it. So this is my suggestion. You have to add this in your journal article. Yes.
Yes, Mr. Thank you.
Yeah, as well as about the limitation of your research. Yeah, because actually when we observe the client with fatigue in terms of hemodialysis is not only 2 days, yeah, across week or months even. So I think this is limitation of your research. So you have to add it as well in your journal article. So what is the limitation of your research? Okay.
Okay, Mr.
Okay, thank you.
Mas Fariha. Panggilnya Lukman apa Mas Fariha?
Hari, Ibu.
Mas. Judulnya adalah Intradialytic Exercise and a Nursing Intervention to Reduce Fatigue in the Hemodialysis Patient. What is meant by fatigue in your research and when is it performed?
Yes, wait.
Mas Lukman?
Yes, in operational definition, fatigue is a decrease in energy experienced by the patient undergoing hemodialysis in the hemodialysis unit. This is measured using the facet fatigue scale to identify fatigue level before and after dialysis.
Oke. Kapan dilakukannya, Mas? Karena kan pasien hemodialisis ya, itu kapan dilakukannya?
Sebelum dan sesudah pengukurannya, Ibu. Untuk ini sendiri dilakukan di 1 jam setelah hemodialisis ini dilaksanakan dengan pertimbangan bahwa TTV pada jam itu masih stabil gitu, Ibu.
Kemudian setelahnya, setelah berapa jam?
Setelahnya itu dilakukan pengukuran lagi setelah intradialitik ini dilaksanakan, Ibu.
Ini sama-sama berisiko ya, kalau menurut saya ya. Kalau dilihat di gambarnya itu bahwa pergerakannya ada pergerakan kepala, tangan, gitu ya. Tangannya naik ke atas, kemudian menggerak-gerakkan kaki, gitu ya. Kira-kira apa semua bisa dilakukan pada pasien hemodialisis ini, Pak? Atau ada kriteria?
Ada di kriteria inklusinya Ibu bahwa yang masuk ke pasien yang boleh dilakukan itu hanya yang memakai double lumen access. Gitu, Bu. Jadi kalau yang memakai avesan tidak kami ambil dalam penelitian.
Oke, thank you. Ya, enough. Iya. Enough, moderator.
Ya, back to moderator.
Thank you to the reviewers and to all participants. With this, all presentation for today have been completed. The presentation by Dr. Sawab and the other participant will continue tomorrow. For reviewers, please return to your seat. Okay, once again, for reviewers, please return to your seat.
No.
Yeah. Thank you.
All right, okay. Good afternoon, Miss Agiri. Yes. Good afternoon.
Good afternoon. Good afternoon.
Good afternoon. For me, Semke, please welcome to our International Conference on NERCI 2025.
Thank you.
And next to our seminar agenda. To continue guiding us through the next session, I'm pleased seminar moderator, Dr. Budi Widianto, Master of Nursing. Before we proceed the seminar, during the seminar, we kindly ask you to keep your microphones muted. Please unmute only when you are given permission from moderator. For participants attending in person, we request that you remain quiet during the session. All materials presented in this seminar will be shared through the Telegram group, allowing you to review them afterwards. And once again, thank you to our media partners at Info Poltekkes and at Info Lomba Nasional for contributing to the success for this event. To Dr. Budi, the time is yours.
Okay, thank you, Master of Ceremony, for the time given, and welcome to Mrs. Femke in Netherlands. Let's continue to the seminar with the presentation of material by our second speaker. Ladies and gentlemen, we would welcome our second speaker, Mrs. Femke van der Heijden, Master of Science, who will deliver material on the theme optimizing comprehensive care in chronic disease patient, physical, psychological, and social collaboration. 30 minutes. Previously, I would read the curriculum vitae from Mrs. Femke van der Heyden. Allow us to introduce Mrs. Femke Gerarda Hendrika Maria van der Heyden. She was born in His on January 13, 1983, and is a Dutch citizen. She is a highly experienced healthcare practitioner with a strong educational background in nursing. She holds a Master of Advanced Nursing Practice from Saxion University of Applied Science, as well as a Bachelor of Nursing from Han University of Applied Science. She has also completed various professional training programs, including postgraduate training in dialysis nursing and palliative care courses for nursing practitioners. Currently, she serves as a nursing lecturer at Han University of Applied Sciences, where she teaches anatomy, pathology, physiology, and technical nursing skills. Before becoming a lecturer, he held various important positions as a nurse practitioner at several leading healthcare institutions in Netherlands. With her extensive and diverse professional background, spanning both clinical and academic roles, we are confident that the insight Femke van der Heyden will share will be highly beneficial and valuable to us all. Let's welcome Mrs. Femke van der Heyden. Give applause for Mrs. Femke.
Thank you.
Okay, no time issues, Mrs. Femke.
Thank you. Thank you for the introduction.
Okay, sorry, unmute first. Sorry, unmute first. Sorry. Your voice is coming in.
Yes, is my voice coming in?
Yeah, good.
Yes. Okay, thank you. Do you have my presentation?
Hello, PowerPoint-nya, Mas. Okay, wait a minute.
Yes.
PowerPoint-nya sana. Punya Bu Femke.
Yes, thank you. So, good afternoon, everyone. Today, I would like to talk to you about optimizing comprehensive care in patients with chronic diseases with a focus on physical, psychological, and social collaboration. Chronic diseases are not just about biological dysfunction, they affect the whole person, their body, their mind, and their social life. The next dia, please. As you know, my name is Femke van der Heyden and I'm a teacher in nursing at the Han University of Applied Science in the Netherlands. Before becoming a teacher, I worked as a nurse practitioner in general practice, a hospital nephrology department, and in nursing home in geriatric care. In each of these settings, I worked with patients who were living with chronic diseases. This population is often complex, fragile, and diverse. Over the years, I have learned that chronic care is not only about prescribing the right medication or monitoring clinical parameters, it's about understanding the whole person, the physical health, their emotional well-being, and their role in society. The program of today I would like to talk about is comprehensive care in chronic disease. So what is chronic care? Why collaboration is essential? I talk a little bit about shared decision-making, about positive health. I have a case, a conclusion, and some take-home messages. So let's start by defining what we mean when we talk about chronic care. The next dia, please. Chronic diseases are not just medical problems, but life problems. Chronic diseases, also called non-communicable diseases, are conditions that tend to be of long duration and progress slowly. The World Health Organization in 2024 define them as the result of a combination of genetic, psychological, environmental, and behavioral factors. Living with a chronic illness affects far more than the body. It influences daily routines, relationships, work, emotions, and overall quality of life. Managing a chronic condition requires more than medical treatment. It demands lifestyle adjustments, ongoing self-care, and emotional resilience. As healthcare professional, it is essential to recognize these broader impacts and provide holistic support that address both the physical, psychological challenges that patients face. With the right treatment and support, patients can live longer, healthier, and more meaningful lives. So what is health? This definition highlights that health is much more than simply being free of illness. It emphasizes a holistic view in which physical, mental, and social well-being are equally important. Despite the fact that it is formulated in 1948, it continues to inspire healthcare practice today, reminding us that true health requires balance and support in all aspects of life. Not only medical treatment, but also social connection, mental resilience, and a sense of overall well-being. Next dia, please. So what is chronic care? The World Health Organization describe it as non-communicable diseases, also known as chronic diseases, tend to be of long duration and are the results of a combination of genetic, physiological, environmental, and behavioral factors. They represent a major global health challenge. Unlike infection diseases, they are not passed from person to person, but rather develop over time. Chronic disease include conditions such as cardiovascular diseases, diabetes, chronic respiratory diseases, and cancers. They are strongly influenced by lifestyle factors, such as diet, physical activity, tobacco, and alcohol use, as well as broader social and environmental determinants. Because of their long duration and slow progression, chronic disease places a major burden on individuals, healthcare systems, and societies worldwide. Next dia, please. Chronic diseases are long-term conditions that requires continuous management rather than a one-time cure. They often develop slowly and are influenced by a combination of genetic predisposition, lifestyle, and environmental factors. Examples of chronic care with this category includes type 2 diabetes, where patients need lifelong attention to blood glucose control and lifestyle modification, chronic kidney disease, which often progress silently and may require dialysis or transplantation in advanced stages, rheumatoid arthritis, a chronic inflammatory condition that requires long-term pharmacological and supportive care, and heart failure, where ongoing monitoring, medication, and self-management strategies are essential to maintain quality of life and prevent hospitalizations. These conditions illustrate how chronic disease demands integrated, patient-centered care models to address both medical treatment and lifestyle support. Chronic care refers to the long-term management of illness that cannot be fully cured, but can be controlled or stabilized. Next dia, please. It is important to understand the difference between chronic care and acute care. Acute care is what most people think of when they imagine healthcare, treating a sudden illness, injury, or infection, often with the goal of curing the problem completely. Chronic care, on the other hand, is ongoing, supportive, and adaptive. It focuses on stabilization, prevention of complication, and improvement of quality of life over time. Acute care ends when the patient recovers. Chronic care never truly ends. It evolves with the patient's needs across the months, years, or even decades. This long-term nature makes chronic care challenging, but also deeply rewarding. For nurses, it offers the opportunity to build meaningful relationships with patients, to support them not only in times of crisis, but in the daily reality of living with an illness. Next dia, please. Chronic diseases represent the greatest health burden worldwide, not only in terms of mortality, but also long-term disability and reduced quality of life. According to the World Health Organization, they account for the majority of premature deaths within significant gender difference. In the European region, 1 in 5 men and 1 in 10 women die before the age of 70 due to conditions such as cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Beyond the personal suffering, this creates a major challenge for healthcare systems and societies, leading to increased health costs, loss of productivity, and social inequalities. These statistics highlight the urgent need for prevention, early detection, and integrate long-term care strategies to reduce the impact of chronic diseases across populations. Next dia, please. Why collaboration is essential. When we look at chronic conditions through the triple lens of physical health, psychological well-being, and social participation, it becomes clear why collaboration is essential. On the physical level, patients need medical treatment, monitoring, and lifestyle support to manage symptoms and prevent complications. On the psychological level, the ongoing burden of living with a chronic disease can lead to stress, anxiety, or depression, requiring emotional support and mental health care. On the social level, chronic illness can limit participation in work, education, and community life, making social support and inclusion vital. No single professional or discipline can address all these dimensions alone. True chronic care requires interprofessional collaboration, involving physicians, nurses, psychologists, social workers, psychotherapists, paramedics, and most importantly, the patient and their family. Only by working together across these domains can we provide care that is holistic, sustainable, and empowering. Next dia, please. The physical dimension is often the starting point when we talk about chronic disease, as they usually begin with some form of physical dysfunction. Patients may experience symptoms such as fatigue, pain, or limited mobility, and they often need long-term medication and regular monitoring. These physical challenges have a direct impact on daily functioning and self-management. However, optimal care is not only about prescribing medication or keeping track of numbers. It is about supporting patients in their everyday lives, whether that means walking to the store, preparing a healthy meal, or playing with their grandchildren. By focusing on physical function in the context of daily activities, care becomes more meaningful and patient-centered. Next dia, please. The psychological dimension reminds us that living with a chronic disease is not only a physical challenge, but also a mental and emotional one. Many patients experience depression, anxiety, or difficulties coping with the constant demands of their condition. The emotional impact of chronic illness can be as challenging as the physical symptoms themselves, influencing motivation, self-care, and overall quality of life. That is why effective chronic care must also address mental health and emotional support. This can include counseling, peer support groups, stress management, or simply acknowledging and validating the patient's struggles. Supporting psychological well-being helps patients build resilience and strengthens their ability to live well despite their condition. Next diapositive. The social dimension shows how chronic illness extends beyond the individual and impacts participation in society. Patients may face social isolation, a loss of work opportunities, or difficulties in participating fully in family and community life. These challenges can reduce independence and increase vulnerability. That is why social resources play a key role in chronic care. Access to community programs, peer networks, and rehabilitation services can make a significant difference. Equally important is the role of family and informal caregivers, who provide daily support and help maintain social connections. By strengthening social participation, we not only improve health outcome, but also enhance dignity, belonging, and overall quality of life. Next dia, please. So what you see here is you need all those three elements, the physical, psychological, and social elements, to create optimal care. So chronic care is most effective when we look through the combined lens of all those three options. For patients to truly thrive, all three dimensions must be considered together. So only by integrating physical, psychological, and social care, we can deliver the best, most holistic, and patient-centered support. When we only treat the physical disease, we miss the bigger picture. Next dia, please. How do we connect these domains in practice? One powerful tool is shared decision-making. Shared decision-making is about creating a partnership between professional and patient. The healthcare professional brings in the medical knowledge, treatment options, and clinical expertise. The patient, on the other hand, contributes their personal values, preferences, and life context. By combining these perspectives, they arrive at a decision that is not only medically sound, but also personally meaningful. For example, consider a patient with rheumatoid arthritis who has to choose between two medications. One medication is more effective but requires weekly injections. The other is less effective but easier to use in daily life. Through shared decision-making, the professional and patient discuss the advantages and disadvantages of both options. And together, they determine what best fits with the patient's lifestyle and priorities. This approach ensures that treatment is not only clinically correct, but also aligned with what truly matters to the patient. Next dia, please. Why does it matter? Because it directly improves the quality of care and the patient's experience. Research shows that shared decision-making reduces decisional conflict, as patients feel more confident and less uncertain about their choices. It also improves treatment adherence, since patients are likely more to follow through with a plan they helped create. And importantly, it enhanced patients' satisfaction, as care becomes more aligned with their personal goals and values. In this way, shared decision-making transforms the patient from a passive recipient of care into an active partner in their health journey. Next dia, please. Key steps in shared decision-making involve a structured but patient-centered process. First, the professional presents the available options clearly without bias. Next, they discuss the pros and cons of each option, including the side effects, effectiveness, and practical implications. Then, it is essential to explore the patient's values and preferences, what matters most in their lives, what fears they have, and what goals they want to achieve. Finally, both parties make a shared choice, combining medical evidence with the patient's perspective. The most important element is not just the treatment itself, but truly understanding the values of the patients. That knowledge is the foundation for making care both effective and meaningful. Next dia, please. Another important concept that helps us broaden our perspective on chronic care is positive health, introduced by Machteld Huber in the Netherlands. Traditionally, health was often defined as the absence of disease. But positive health invites us to look further. It shifts the focus towards a person's ability to adapt and self-manage in the face of physical, emotional, and social challenges. This means that even when someone is living with a chronic condition, they can still experience health and well-being by finding balance, resilience, and meaningful participation in daily life. Positive health therefore encourages a more holistic, empowering, and person-centered approach to care. Next dia, please. The concept of positive health is made concrete through 6 interconnected dimensions: bodily functions, the physical aspect of health, such as symptoms, mental well-being, emotional resilience, mood, and the ability to cope with stress, meaningfulness, having a sense of purpose, motivation, and direction in life, quality of life, being able to take part in work, social activities, and community life, daily functioning, managing everyday tasks, independence, and self-care. Together, these 6 dimensions show that health is more than the absence of disease. They emphasize a broad holistic view where patients can experience health even when living with chronic conditions. Next dia, please. A useful tool to visualize positive health is the spiderweb model. In this model, each of the 6 dimensions of positive health, so bodily functions, mental well-being, meaningfulness, quality of life, participation, and daily functioning, are represented as an axis on the spider web. Next dia, please. So how does the spider web work? Patients are invited to score themselves on each dimension, creating a personal health profile. The resulting web is not a fixed diagnosis, but a conversation starter. It helps professionals and patients discuss what areas of life are going well and where support or change is needed. The strength of the spiderweb is that it shifts the focus from what is the matter with you to what matters to you, making care more holistic, empowering, and patient-driven. Next dia, please. When the spider web is filled in by a patient, it provides a clear and personal picture of how they experience their health across the 6 dimensions. Some areas of the web may score high, for example, daily functioning and mental functions and perception, while others, such as existential dimension and quality of life, may score lower. The value of the spiderweb is not the numbers themselves, but the story behind the scores. It opens the dialogue between patient and professional. So why is this area important to you? What helps you to cope? Where would you like to see improvement? In this way, the spider web becomes a conversation tool, helping to identify patients' priorities for care and support that truly match the patient's values, needs, and goals. It shifts the consultation from a medical checklist to a shared exploration of what matters most in daily life. Next dia, please. When we look at the spider web after 1 month, we can see clear improvements across several dimensions. For example, quality of life and bodily functions may have increased thanks to better symptom control and lifestyle adjustments. Mental well-being and quality of life often rise as patients start to feel more in control and experience small successes. These positive changes are encouraging, but the spider web is not about achieving a perfect score. Instead, it helps us and the patient reflect on progress over time. What has improved? What contributes to this improvement? And what areas still need attention? In this way, the repeated use of the spider web makes health development visible and tangible, reinforces motivation and strengthens the partnership between patient and professional. It turns care into an ongoing process of adaptation, empowerment, and growth. Next dia, please. Why does positive health works? Because it goes beyond the traditional biomedical focus on symptoms and disease alone. Instead, it takes into account the wider context of a patient's life. Positive health also empowers patients by making them active participants in defining what health means to them and identifying what areas they would like to improve. Most importantly, it helps to align care with the patient life goals. This ensures that care is not only clinically appropriated, but also meaningful, motivating, and sustainable in daily life. Next dia, please.
Mrs. Femke, you have
Yes.
5 minutes left.
Okay. Yes.
All right. Yeah, thank you.
Okay. A key strength of the positive health approach is that it stimulates reflection and dialogue instead of focusing on medical issues. We ask open questions that invite patients to share what truly matters to them. Here are some examples. Next dia, please. Next dia, please, because I don't have enough time for the case. Next dia, please. Next dia, please.
Sebelumnya.
And next dia, please. Yes. Then we come to the conclusion. Chronic care must always be multidimensional. To support patients effectively, collaboration is needed across the physical, psychological, and social domains. Treating only symptoms is not enough. We must also address emotional well-being and social participation. Shared decision-making plays a central role as it empowers patients to actively shape their care in line with their values and preferences. In addition, the concept of positive health helps us broaden the focus beyond diseases towards what truly matters in life, meaning, participation, and personal goals. This shift represents a transformation in thinking. We move from a model of disease management where the focus is on controlling illnesses to life management, where care supports people in living a meaningful, resilient, and fulfilling life despite chronic conditions. Next dia, please. Then I have some take-home messages. So chronic care is lifelong and multidimensional, not just medical, but physical, psychological, and social. Physical health is just one part of the puzzle. Mental well-being and social participation are equally crucial. Collaboration across disciplines creates more effective and sustainable care. Shared decision-making empowers patients and improves adherence and satisfaction, and positive health reframes focus from disease control to living meaningful life. So optimizing care means shifting from disease management to life management. Thank you.
All right. Well, please give applause once again for Mrs. Femke, who has delivered his extraordinary material. Thank you to Mrs. Femke for the interesting presentation. I hope it will be useful for all of us. Amen. Dear participants, ladies and gentlemen, let's move on to the next session, the question and answer session with a time of 15 minutes. We'll have time for 3 questions. Those in this room are welcome to raise your hands, and those on Zoom room, you can use raise hand feature on the comment section by introducing yourself. Okay, now raise your hand. Anybody? Okay, all right. There is 2 people here. For ladies first.
Good morning from the Netherlands, Mrs. Vinke. My name is Septiani Wayu Kurniasari. I'm a third-year nursing student in the A1 regular class 1 diploma of Diplomatry of Nursing course at Poltekkes Semarang. Thank you for the insightful presentation. First, I want to ask about considering that chronic patients, particularly those with chronic kidney disease, experience complex and progressive psychological change, what nursing strategies would be most effective in not only maintaining and managing this change, but also ensuring the early prevention of potential complication. Furthermore, how can these strategies be adapted to diverse healthcare settings with varying level of rescues and patient engagement? Thank you.
All right, you can answer directly, Mrs. Femke.
What is important, the patients with chronic kidney disease are, you see a lot of anxious depression. What is important to do as a nurse is that there is time to talk about how do they feel, what do they need to feel better, and not only that there not only is time to discuss their physical disease, but also the mental and the physiological and social part. How you can do that? The spider web of Machtel Huber, what I showed you in the presentation, you can use that to talk with the patient and see what is most important for the patient and where will the patient will work on first and second, and so you can make a plan with the patient.
Okay, all right. Thank you very much, Mrs. Femke. The second question from Ms. Arifah Amani in Zoom room. Arifah Amani, time is yours. Yeah.
All right, first of all, thank you for this opportunity. Allow me to introduce myself. My name is Arifah Amani. I am in my 3rd semester at the Polytechnic Semarang. I would like to ask a question. The question is, what strategies are being implemented to maintain mental health and cope with anxiety or depression due to chronic illness? That's my question. Thank you.
Can you repeat the question one time?
Okay, the question is, what strategies are being implemented to maintain mental health and cope with anxiety or depression due to chronic illness? Thank you.
You're welcome. What we do in the practice with mental health is if we see and talk with patients about mental health, then we prescribe them another. To the general practice, we have a special person for mental health care, and they going to talk with the patient for mental care. Is that not enough? They go to the psychologist. So what we do is we let me think about it. We prescribe them the right person to talk to. Does not only take the care with me, but also every other physicist. So we need to do it together, not only the nurses, the doctors, but also the psychiatrists, the psychologists. So as it's important that they know where they need to go.
Okay, thank you, Mrs. Pemke. Now the third question. Okay, raise your hand. Okay, all right, go ahead. Yeah, stand up, please.
Thank you for the opportunity, Mr. Budi Widianto. Good morning in the Netherlands, Miss Femke. My name is Aditya Rahman. I am the third nursing student in nursing department in Health Polytechnic of Semarang. I want to ask a question to you.
Yes.
How a nurse can identify and address psychological issues that may be hidden in patients with chronic illness so that we can help improve their quality of life? Thank you.
For the nurses, it's very important to listen and acknowledge that there is a problem. And when you see and hear that there is a problem, then it's important that you talk to the patient, but also talk to the doctor, so that the doctor can take steps for the patients to go further than the nurse. But as a nurse, you have a very you're playing a great role in the life of the patients. So it's important to listen and acknowledge that there is a problem and that you want to look with the patient to results.
Finish, Mrs. Femke?
Yes.
Yeah, okay, thank you very much for the question. And amazing question answer with even more amazing answer. Give us all a round of applause. Okay, now it's time for us handling over e-certificate to Mrs. Femke. To the committee, time is yours. Yeah, this is your certificate, Mrs. Femke. Thank you very much for your kind participation in this NERCI.
Thank you very much.
Yeah, and you can leave the room. Thank you very much.
Okay, thank you.
Okay, as we come to the end of the event, this concludes the event of NERCI, School of Nursing Poltekkes Kemenkes Semarang. The speakers inspire us with their extraordinary material and help us upgrade ourselves to become students with broad and developing thinking. That concludes my remarks. I would like to thank the speaker and all participants for their participation, ensuring the event runs smoothly and without any issues. I apologize for any errors or shortcoming in guiding this morning seminar. Finally, as moderator, I am signing off. Hopefully, we can meet again at another event. I will now hand over the event to the Master of Ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Dr. Budi Widianto, Master of Nursing, as the moderator of this seminar event. To Dr. Budi, please return to your seats. Thank you very much for the speakers for the informative and insightful presentation. And once again to the moderators that lead the third International Conference on NERCI on this day. Ladies and gentlemen, the second day agenda will be more interesting. The agenda is continue our seminar with great speakers. They are from Philippines, Indonesia, and Nepal. And then announcement for the winner and more exciting agenda. Okay, ladies and gentlemen, those are the agenda that we have on the first day of the third International Conference on Nursing Education, Research, and Clinical Practice. We will resume with our second day agenda tomorrow, which will begin at 8 a.m. We hope that all invited guests and participants are ready for tomorrow's session. Thank you for your attention and participation. We will see you again tomorrow. Wassalamualaikum warahmatullahi wabarakatuh.